A very good evening, everyone. Good evening, everyone. Hello, Dr. Farhan. Hello, Kangsha. Hello, Nehal. Thank you, Dr. Swati. A very warm welcome to everyone, guys. Thank you, Dr. Amit. Good evening, everyone. Yes. Hello, my dear doctors. A warm welcome to all of you, and a very good evening to all of you guys. Thank you. Good evening, Saddam. Good evening, Kishore. नमस्ते मोहित मैं ठीक हूँ हेलो सर गुड इवनिंग अ वेरी गुड इवनिंग सर या so hello my dear doctors, a warm welcome to all of you. First of all, to begin the session with, this is Dr. Azam here, your faculty of anatomy. And now my dear doctors, just keep this here. I'm seeing all your messages here, sir. Yeah. चलिए सर. So, hello, my dear doctors. Warm welcome to all of you here. This is Dr. Azam here, your faculty of anatomy. And I'm going to actually now discuss with all of you all the high yield topics of anatomy, which are necessary and which are like must do, should do topics before going to your exam. So, all the students who are actually preparing for your MCA exam this January 2024 MCA exam, तो उन सब के लिए ये सेशन बहुत ही important है. And in this session, we are going to cover all the very, very high yield topics. Actually, those topics which you have to learn and go to the exam, sir. Okay, now. Thank you, Sriniket Kumar. Thank you. ठीक है. Now, first of all, to begin this session with here, thank you, Mansoor Alam. Now, to begin this session here, my dear friends, actually, I would like to thank, this is a very good initiative that we have done here right now. Why? Because I think you all know, like recently, like few days back, we also had a YouTube session where they have actually, come up with a very, very nice thing that there is a collaboration between ISM EduTech and the doctortorials. And because of that collaboration, right now, we are able to do this live session on the YouTube channel of Dr. Bhanu Prakash sir. And I would like to thank Dr. Bhanu sir for allowing me and giving me this opportunity to actually come onto this channel here, YouTube channel, and share my knowledge with you people and help the students also. Yes. So with that note, guys, actually it is like a good situation for us. Okay, this collaboration is a very good collaboration here. And now with this one, let's get started right now, sir. Take it now. So, my dear doctors, this will be like a rapid revision session. And in this session, I'm going to discuss all the very, very high topics of neuroanatomy, then head and neck, embryology, upper limb, lower limb. And then I'll be also dealing with thorax, abdomen, pelvis, and perineum, like all the topics we are going to discuss like one by one, all the higher topics we're going to discuss. So, is it okay? So without any further ado, let's get started right now, sir. Now, the first topic that we are actually going to begin here will be neuroanatomy, sir. Okay, now. So because you will are like fresh right now, so let's get started with the neuroanatomy first of all. And then we'll be doing like head and neck topics, sir. Then in the middle, just to balance the class, we'll do some easy topic. Then also we're going to do the embryology part, sir. Okay, now. So we are going to actually do all the higher topics, sir. Are you all with me? Just give me a thumbs up, guys. If you are with me, let's get started right now. So yes, Srilekha, Abhishek, yes, sir. Yes, sir. Okay. Thank you, Chief. Thank you, sir. Actually, the volume, video, everything is actually perfect from our end over here. Yes. my dear friends. Why? Because if there is any problem in the volume from here, then obviously it will be the issue for all of them, sir. Okay, no? Thank you, Mohit. Thank you, Mohit. Thank you, thank you, thank you, thank you. Chलिए sir, all good. Let's get started right now. ठीक है ना? So now the first thing that we are going to discuss, that is about the neuroanatomy topic, sir. अब मैं आपको बताऊंगा कि in neuroanatomy, like what are the topics that you have to actually learn for your MCI exam. Okay. Now, my dear doctors, if you are able to see here in this session, the first topic that we are going to discuss is about the sections of the brain, sir. Fine. So number one, we are going to discuss the coronal section, and then we are going to discuss the sagittal section as well as the transverse section of the brain, sir. So in this manner, remember, your exam is not going to get completed without these sections in the exam, sir. Your MC exam, your paper will not be completed without the section. So definitely one or two questions will be actually coming from these three sections here, sir. So first, let's get started with the coronal section. And as you can see here in the coronal section itself, we are actually going to discuss about what's the lateral ventricle also. So in this diagram, this one here will be the lateral ventricle, and this is another lateral ventricle. Both the lateral ventricles will open into the third ventricle, sir. With the help of opening, that opening is known as the foramen of Monro. Okay, now? So I would request everyone to like fully concentrate here, sir, for another like couple of hours. Okay, now? Another for a couple of hours, sir. एक 2-3 घंटे के लिए completely along with me, guys. ठीक है ना? सब लोग मेरे साथ में, forget about everything. Please keep your phone on that, without notification wala mode. Off all your notifications on. Just be with me here, sir. ठीक है ना? Now, so in this diagram, first of all, you're able to see the two lateral ventricles, and the lateral ventricles will open into the third ventricle via foramen of Monro. ठीक है ना? Now, if you're able to see just above the lateral ventricle, अगर आप lateral ventricle के ऊपर देखोगे, there is a bundle of fibers, and this bundle of fibers will be connecting the right half and the left half. Now, I hope all of you know that the right half of the brain and the left half of the brain are connected to each other with the help of commissural fiber, and the largest commissure will be the corpus callosum, sir. So which one will be the largest commissure? That is your corpus callosum. And this one here will be the corpus callosum. And this corpus callosum is actually going to form the roof of the lateral ventricle, sir. So in the diagram, you can very clearly see this is going to form the roof of the lateral ventricle. Now, between the two lateral ventricles, we are able to appreciate one septum here in the middle. And this septum here will be the septum pellucidum. This septum will be the septum pellucidum, sir. And just attached to the lower margin of the septum pellucidum, this one here will be the fornix, sir. And this one is extremely important for your MCI exam, sir. Not only MCI exam, even for other exams also, the fornix is very much important. You should be always able to identify fornix in every section possible, guys. Now, for example, if my hand here is like septum pellucidum, on either side you're having the lateral ventricle, the lower border of the septum pellucidum will be attached with the two fornix like this. So both the fornix are coming here like this. The lower border of that is attached. And these two, that is septum pellucidum and the fornix here, are going to form the medial wall of the lateral ventricle, sir. So septum pellucidum and the fornix are together going to form the medial wall of the lateral ventricle. Perfectly done. Then in this diagram, this one here will be the caudate nucleus here. And then this one here will be the thalamus here. In between the caudate nucleus and thalamus, there is a vein. And this vein here will be the thalamostriate vein, sir. Thalamostriate vein. And yes, you are able to see the network of capillaries over here. And this network of capillaries is nothing but choroid plexus. And all these four structures are going to form the floor of the lateral ventricle, sir. It is going to form the floor of the lateral ventricle. So number one, this one here will be the caudate nucleus. Number two, this one here will be the thalamostriate vein. Thalamostriate vein, sir. And this one here, the network of capillaries here, that is choroid plexus. And this part here will be the thalamus part, sir. And all these four parts together, they are going to form the floor of the lateral ventricle. Wow. So in this manner, my dear doctors, in this diagram, we are actually done with the roof here. We are done with the medial wall here, and then we are done with the floor here. Perfectly done, sir. So in this manner, actually, we are actually done with the lateral ventricle, all the boundaries of that, and even the coronal section is also done, sir. If you know these structures in the coronal section, then no need to worry about the any other structures, sir. Yes, remaining things you already know very well. And the outer part of the brain will be the cerebral cortex, and then from there we'll be having corona radiata, internal capsule. ये तो सब कुछ आपको already पता है, sir. Okay, so I'll just show you here, sir. This outer darker part here of the cerebral hemisphere will be known as the cerebral cortex. And from the cerebral cortex, there will be the fibers starting in the fan-shaped manner, that is corona radiata. And all these fibers will converge together and they're going from here, that is internal capsule. तो ये सारी चीजें तो आपको already पता है. That is the reason why I want you to concentrate on these structures here. अगर ये याद हो गया, तो that's all, sir. You are done with the coronal section. Perfectly done, sir. ठीक है ना? Is it okay? Fine here? Yeah. So, my dear doctors, let us just revise this once more, and it is worth repeating right now, sir. Come on, tell me. What is going to form the roof of the lateral ventricle? Corpus callosum. The medial wall is formed by septum pellucidum and the fornix. And the floor is actually formed by the fourth structure, the chordate nucleus, thalamostriate vein, choroid plexus, and the thalamus, sir. All these structures are forming the boundaries of the lateral ventricle. Perfectly done. Now here itself, let me tell you like one more point here, my dear friends, about the fornix. I hope you all have learned about the limbic system. The limbic system will be having thalamus and the fornix and the mammillary body and all. So just draw one small diagram here, sir, along with me. So my dear friends, for example, if this one here will be the thalamus, and the thalamus will be continuing into the, hippocampus, and hippocampus will continue into the fornix, and that fornix will go and join with the mammillary body. So hippocampus, and finally it is going and joining with the mammillary body here, sir. So this one here will be the hippocampus, and this one here will be the fornix, and this will actually go and join with the mammillary body, sir. With the mammillary body, and all this will be actually the components of your limbic system only. Okay, now so there'll be hippocampus and the fornix and the mammillary body. So fine. Now one important MCQ that you have to learn from here is fornix on one side will be joining with the fornix on the other side, and I just now told you the basics very clearly. Anything like joining the right half of the brain with the left half of the brain will be actually known as your commissural fiber. So obviously it is joining the right fornix with the left fornix. So इसका नाम क्या होना चाहिए? What should be this one? This is commissure. But listen very, very carefully. This one will be hippocampal commissure. Which commissure is this one? Hippocampal commissure. But the important point here is that hippocampal commissure connects what? What it is connecting, sir? Remember, it is going to connect the fornix on either side. Please don't mark in the exam as hippocampus. Remember that hippocampal commissure is going to connect fornix on either side, sir. क्योंकि क्या होता है in the exam, 19 subjects will be in your mind. Of course, if you study and go, 19 subjects in the mind with full of tension, anxiety, and all. And in the exam, what will happen? Common sense will dominate, sir. On that day, no anatomy, no Azam, sir, nothing there. On that day, common sense will dominate. And hippocampal commissure connects what's it? Hippocampus. लगा दिया. And फिर result आने के बाद में dash. समझ में आ रहा है? तो इसीलिए please remember that hippocampal commissure connects what's a fornix. It is going to connect fornix, not hippocampus. Second point here is that this fornix is going to begin from where? Okay. So remember, I told you the fornix is between the mammillary body and the hippocampus. But you have to remember that the fornix is going to begin from where? So remember, it's going to begin from the hippocampus and it is going towards the mammillary body. Even that was also asked in the exam, sir. So please remember, the fornix is going to begin from hippocampus and it is going towards the mammillary body, sir. Perfectly done. So we are done with the coronal section. Along with that, this part is also discussed. So 2 MCQs here, sir. So about the fornix. Fornix is going to begin from hippocampus and fornix are connected by what, sir? Hippocampal commissure. 2 important MCQs covered here, sir. In small diagram here. Okay. चलिए अब बढ़ते हैं आगे towards the sagittal section here. Now, Again, the same thing in this diagram. First of all, you are able to see this largest commissure here. This is corpus callosum. In your MCA exam, once they have asked about the parts of the corpus callosum. In the corpus callosum, we'll be having like 4 parts. This one here will be the rostrum. This bent here will be genu. And this is the body here. And finally, this one here will be the splenium, sir. Again, so there'll be rostrum and the genu. And then there will be a body. And finally, you'll be having the splenium. Okay. And now, abhi मैंने आपको बताया था, just now I told you, below the corpus callosum, you're able to see that septum pellucidum here. And below that, the lower margin will be attached to the fornix there. So therefore, my dear doctors, this structure here will be again the same thing. This is fornix. And below the fornix, you'll be having the choroid plexus. This is the choroid plexus. And you can clearly observe here, this one will be the third ventricle. So if this one will be the third ventricle over here, you can clearly see in the diagram here, sir, what is going to form the roof of the third ventricle. The roof of the third ventricle will be formed by fornix and the choroid plexus. This is going to form the roof. Perfect. Now, below the rostrum, this commissure here will be known as the anterior commissure. And below the anterior commissure, there will be lamina terminalis. This one will be the lamina terminalis. And these two are going to form, obviously, the anterior wall of the third ventricle. Done? Then behind, what do you have? How to identify this one? Observe this thing very, very carefully here. Below the splenium ke niche, yes, there will be a gland here. This gland will be known as the pineal gland, sir. That is the important landmark here. First, you identify the pineal gland. And after identifying the pineal gland, this commissure here below the pineal gland will be posterior commissure. And above the pineal gland, you'll be having the habenular commissure, sir. Habenular commissure. And of course, this duct here, everyone knows, guys, this duct is known as the aqueduct of Sylvius, sir. Wow. So please understand the method to identify. पहले आप क्या करोगे? Splenium देखोगे. Splenium तो clearly नजर आएगा. और splenium के बिल्कुल नीचे, below the splenium, there will be pineal gland. और pineal gland के नीचे होता है posterior commissure और उसके ऊपर होता है habenular commissure, sir. And the duct is aqueduct. And we can very clearly see in this diagram here. Yes, my dear friends, all this is going to form which wall of the third ventricle? The posterior wall of the third ventricle, sir. Okay, so we are done with the roof here. We are done with the anterior wall here. And then we are done with the posterior wall here, sir. Wow. So in this manner, very clearly, like crystal clearly, we are done with the boundaries of the third ventricle. The roof is done, anterior wall is done, posterior wall is done. And now welcome to the floor of the third ventricle. That is extremely important. Okay. Now this crossing here is known as the optic chiasma. So this crossing here will be the optic chiasma. Below the frontal lobe here, below the frontal lobe, there'll be eyeball. And from the eyeball, you'll be having optic nerve and optic nerve. Fine. Below the eyeball, there'll be optic nerve. Eyeball will continue behind into optic nerve. And optic nerves will be actually crossing there to form your optic chiasma. Fine. And just behind the optic chiasma, this part will be your infundibulum. And infundibulum will be attached to the pituitary gland below, sir. And this body here, again, the same thing. This is the mammillary body. And this perforated substance here will be the posterior perforated substance. And this part is actually the midbrain wala part. But in midbrain, my dear friends, within few minutes, I'll show you here. जो aqueduct होता है ना, aqueduct is an important landmark. Why? Because whatever part that you find behind the aqueduct, that will be the tectum part. And in front of the aqueduct, this part here will be the tegmentum part. To be more specific, it is the tegmentum part of the midbrain, sir. And all these structures are going to form the floor of the third ventricle. Wow. Are you understanding me here? तो एक बार दोबारा रिपीट करते हैं सर. It is worth repeating. And in the ventricles nerve, the floor are very much important, sir. So first of all, you'll be having optic chiasma. Just behind the optic chiasma, there'll be infundibulum. Then behind that, there will be mammillary body. Then there'll be posterior perforated substance. And then there'll be tegmentum part of the midbrain. All this together, they're going to form the floor of the third ventricle. Ho gaya, that's all. Now, in this diagram of sagittal section, if you know these structures, my dear friends, that's all. That's all. For any exam, you're ready. Why? Because the remaining things to humko padhne ka zarurat hi nahi hai. This is midbrain here. And this one will be actually the pons here. And this will be the medulla here. And this one will be the cerebellum here, sir. And if this is the hindbrain, this ventricle here will be the fourth ventricle. ये तो मतलब सबको पता है. Even a first year MBBS student knows this very well, sir. Understanding your point here? So these are the structures you have to know, sir. So by this, we are done with the coronal section and the sagittal section. Now in this session, let's have integration between anatomy as well as the radiology also. Why? Because nowadays, you know very well how they are asking the questions. Hai na? They are actually integrating like images given in the radiological format, but the question will be actually anatomy question only. So let us try to identify the same thing here also. तो अभी जो हमने यहाँ पर पढ़ा है, so let's have a comparison with the radiological image right now, my dear friends. Now, in this image, you can clearly see this structure here will be what here, sir? This one will be the corpus callosum. Just below the corpus callosum, this one here will be the fornix. Wow. And this ventricle here obviously will be the third ventricle here, sir. And try to identify this one here is aqueduct. So aqueduct के पीछे वाला जो part होता है, that is your tectum part, and this is actually the tegmentum part. And please try to identify this body. This body will be the mammillary body here. This gland here will be the pituitary gland there. And this is the infundibulum of the pituitary gland. In front of that, this is optic chiasma. So I hope you are able to identify all these structures over here, sir. Is it okay? Perfectly done. So in this manner, we are done with yeah. Hello, my dear friends. Actually, I got a call from the technical team that like some people are actually commenting there regarding the brightness here. I'm taking the class. Whatever I'm writing here on the iPad, it is completely like full brightness here. And even which is being relayed from here on the MacBook here, it's like full brightness, like completely like from here, there is no issue at all. It is completely like full of brightness here. Okay, na? Chaliye. So fine, let's not actually get disturbed with all these things here, sir. Fine. So there is a coronal section here and the sagittal section. Both are done, sir. Yes, Pushpendra Singh is telling all normal, sir. Everything seems okay on the screen, sir. Yes. Actually, our online classes, it will be like very nice. Why? Because I'll be telling you my experience. If there is any problem from my side now, if there is any problem from my side or our side, from our technical team side, then it will be a problem for all the students. अगर मेरी आवाज नहीं आ रही तो सबको नहीं आ रही है, तो it is easily identifiable in the chat, chat box that सबको issue होगा. Agar 1 or 2 or 3 4 people are messaging there, it means that they are having the issue at their end. So please try to check your internet there. You should have a proper Wi-Fi there, because the Wi-Fi has to be like the high-speed Wi-Fi from both the ends, from my end as well as your end. And from my end, it's like perfectly fine. Thank you, Ji. Continue, sir. Thank you, sir. Everything is good, sir. No problem, sir. Yeah. That's what I'm just trying to clarify for the others. So it's not a problem from my end. If there is a problem from my end, it'll be for everyone. It'll be for everyone. Okay, no? Thank you, Ji. आगे बढ़ते हैं, sir. Now let us go ahead with the transverse section right now, sir. So we are done with the coronal section. We are done with the sagittal section. Now let us learn about the transverse section of the cerebrum. Fine. Now in the transverse section of cerebrum here, there will be caudate nucleus here, sir. This will be thalamus here. And this one here will be the lentiform nucleus. Very much important for your MCA exam, sir. Many a times in your MCA exam, they have given an image, and even the radiological image was also given there, sir. And they have given an arrow mark here, and you have to identify that nucleus. And that nucleus is clearly identifiable. That is lens-shaped nucleus, lentiform nucleus there, guys. Okay, now after that, the caudate nucleus, thalamus, and lentiform. In between them, you'll be able to find this bundle of fibers here. This is nothing but your internal capsule. What is that one? Internal capsule. Fine. So now let us discuss about this internal capsule in detail here, sir. In your MCA exam, they're asking a lot of questions regarding this one. So let us discuss about the internal capsule here, sir. Fine. Now, for example, if this one here will be the internal capsule here, sir. First of all, the relations of this one. What do you have on the lateral side of the internal capsule? That is lentiform nucleus. What do you have on the medial side? On the medial side, there will be caudate nucleus. And then here, you'll be actually having the thalamus, sir. So on the lateral side, there'll be lentiform nucleus. And on the medial side, we'll be having caudate and thalamus. Perfectly done. Take it up. Then after that, how many parts are there? Relations are done. Relations are done. And now the parts. There are totally 5 parts in the internal capsule here. This limb will be the anterior limb. The bent in the middle will be genu. And this limb here will be the posterior limb, sir. But the important concept here is that the posterior limb kahan tak hota hai, sir? The posterior limb will be up to where? So remember, till wherever you actually have your lentiform nucleus, till there will be the posterior limb. That is a landmark. So the posterior limb will be up to the lentiform nucleus. Then whatever part you have behind the lentiform, retrolentiform, below the lentiform, sublentiform. So in this manner, internal capsule will have totally 5 parts, sir. Anterior limb, the genu, the posterior limb, retrolentiform part, and the sublentiform part. Sublentiform part, sir. Take it now. Now the important thing here is what are the tracts which are going to pass from here? So number 1, there is a tract passing through genu part, and that tract will be cortico-nuclear tract, sir. So cortico-nuclear tract is passing from which part of the internal capsule? Genu part, sir. Cortico-nuclear tract is passing through which part, sir? Genu part. Then there is one more tract passing from here, your favorite one, that is cortico-spinal tract, sir. And corticospinal tract is also known as pyramidal tract. Pyramidal tract, the very famous one. And it is passing from anterior to third. ये याद रखना बहुत important है. Anterior to third of which limb? Posterior limb. Posterior limb तो सबको पता होता है. Even first year MBBS student will also be knowing it is passing through posterior limb only. लेकिन कहाँ से? Anterior to third of the posterior limb, sir. Anterior to third of the posterior limb. Are you all perfect with this one here? So please remember about these 2 tracts here, sir. From the genu, there will be cortico-nuclear tract, and from the anterior 2/3 of the posterior limb, there will be corticospinal tract, sir. Okay, now, now, my dear doctors, let me just add one more point over here, sir. I hope you all have heard about the geniculate body, sir. There will be a lateral geniculate body, and then there will be a medial geniculate body, sir. On the lateral side, lateral geniculate body, and on the medial side, medial geniculate body. And I think all of you have heard about these 2 geniculate bodies, and they come in the visual pathway and the auditory pathway also. Lateral geniculate body, please remember that L for lateral, L for light. So lateral geniculate body comes under visual pathway. Medial geniculate body, remember M for medial geniculate body and M for music. And that comes in the auditory pathway, sir. Wow. This is how things become easier right now. So L for light, L for lateral geniculate body, M for music, M for medial geniculate body. That comes in the auditory pathway. Now from the lateral geniculate body, whatever fibers are going to begin, these fibers are going to pass through the retrolentiform part. From the lateral geniculate body, optic radiations are going to begin, and they are going to pass through which parts, sir? Retrolentiform parts. So this radiation here will be referred to as optic radiation. And obviously, optic radiation will be going to which area? It will be going to the visual cortex. And what is the number of the visual cortex? Area number 17, 18, and 19, sir. Wow. So therefore, optic radiation is going through which part? Retrolentiform part. Okay, ji, done. Medial geniculate body, I told you it is actually coming under which pathway? Auditory pathway. And from here, there will be obviously auditory radiation. And auditory radiation will be going to pass through the sublentiform part, sir. So this radiation here will be the auditory radiation, and this auditory radiation is going to pass through sublentiform part. और ये कहाँ जाएगा? Obviously, this will be going to the auditory area, and that is area number 41 and 42. Or important thing in the exam, they have given the name of this gyrus here. This is also known as the Hessel's gyrus also. इसको हम Hessel's gyrus भी कहते हैं, sir. Understanding point here, guys? So therefore, remember, auditory radiation is going to pass through which part, sir? Sublentiform part. Fine here. So please remember in this manner, L for light, L for lateral geniculate body. So lateral geniculate body will come under which pathway? It will come under visual pathway. So automatically you will be getting the remaining answers. Obviously, अगर वो visual pathway होगा, तो optic radiation होंगे. They'll be going to which area? Visual area. And then medial geniculate body, remember M for medial geniculate body, and remember M for music, auditory pathway. तो कौन सा radiation होगा? Auditory radiation. That will go to which area? Auditory area. And of course, they have asked in the exam about the Hessel's gyrus also. Sir. Understanding? So in this manner, what I have completed here is all the tracts which are passing through which part of the internal capsule. So let us do it once more here, sir. It is worth repeating. Number one, corticonuclear tract is passing from genu part. Number two, corticospinal tract is passing from anterior 2/3 of the posterior limb. Similarly, optic radiations are passing from retrolentiform part. Similarly, auditory radiations are going to pass from the sublentiform parts. So each and every part, which radiations or which tract is passing, we have completed, sir. And not only that, if you are observing my diagram very carefully here, sir, in this rapid revision session, in one diagram, we are actually done with like all the points regarding internal capsule, sir. So internal capsule आपको पता चल गया है. You know the parts of the internal capsule there itself. You know the relations of that one, lateral and medial relations of this one. And then you're also done with the tracts here, sir. So many points regarding the internal capsule has been completed here, sir, in a simple manner. Okay. चलिए आगे बढ़ते हैं, sir. Let's go ahead right now. Now, after completing about these three sections here, hello, my dear doctors. After completing about these three sections here, now I can guarantee you that definitely 1 or 2 marks you can easily solve in the MC exams. Definitely you'll be getting like 1 or 2 marks in the MC exam. Because exam will not be completed without these three sections. So you have to be like perfect with the coronal section and the sagittal section and the transverse section, sir. So all the sections should be perfectly done, sir. Clear? Next one. After that, another important topic for your MC exam is spinal cord, sir. Or spinal cord, you don't have to worry about everything there. I'll just tell you what to learn. Extent of the spinal cord is extremely important for your MC exam, sir. Now, in the extent, first of all, in adults. In adults, spinal cord will be extending from C1 to L1. L1, which border, sir? The lower border of L1. Then in the neonates, it will be from C1 to L3. L3, which border? The upper border of L3. So first, you remember about the extent of the spinal cord. In adults, C1 to L1, and in the neonates, it will be from C1 to L3. After that, I want you to just remember the ending part of the spinal cord, sir, the last part. Okay. Now, in the ending part of the spinal cord, I hope you all know that the spinal cord will end in a cone-shaped structure. And that cone-shaped structure will be referred to as conus medullaris. Spinal cord ends in a cone-shaped structure, conus medullaris. और अभी मैंने आपको बताया था कि spinal cord end कहाँ पर होता है, sir? It is ending at the level of L1. At the level of L1, sir. Then after L1, what do you have? In the remaining lumbar and the sacral and the coccyx, up to coccyx, what do you have there? So remember, there will be a fine thread-like structure all the way going up to coccyx. And this fine thread-like structure is known as phylum terminale. Now, what is this phylum terminale? Remember, it is the modification of your pia mater. So what is the innermost meninge here? Pia mater. And pia mater is not going to stop here. That will continue down. And that continuation of the pia mater itself is nothing but the phylum terminale. So pia mater itself will continue down to form your phylum terminale. Now automatically, what is the next doubt in my mind? अगर ये pia mater है, तो फिर arachnoid and dura कहाँ है? So arachnoid and dura mater are going to descend down and join with the pia mater. Arachnoid and dura mater will descend down and join with the pia mater. So you imagine this blue colored line here to be the arachnoid matter as well as the dura mater here, sir. Okay. Now, the first point that you have to learn is where is this arachnoid and dura mater joining? It is joining at the level of S2, sir. Remember, spinal cord is ending at L1, but arachnoid and dura mater, it is going to join at the level of LS2. Now, if there are like three meninges, how many spaces do you have, sir? Now, between the dura mater and the arachnoid mater, there'll be subdural space, and between the arachnoid mater and the pia mater, there'll be subarachnoid space. So now, if this is arachnoid here and the pia mater here, what is the space here, sir? ये स्पेस जो होती है इसको हम कहते हैं सब एरेक्नॉइड स्पेस और यहाँ पर क्या होता है व्हाट डू यू हैव इन द सब एरेक्नॉइड स्पेस सीएसएफ होता है दैट इज द रीजन व्हाई यू विल बी एबल टू डू द lumbar puncture here and lumbar puncture is most commonly done between L3 and L4, sir. Perfectly done. So spinal cord will end at the level of L1 and we can do the lumbar puncture at the level of L3 and L4, between L3 and L4. Why? Because, yes, here the spinal cord will not be damaged. So, understanding? So there are like so many MCQs here, you have to remember them. So let us just repeat this once more here. The spinal cord ends in a cone-shaped structure, conus medullaris. From there, there is a fine thread-like structure, filum terminal. Filum terminal itself is a modification of pia mater. It's a modification of what's a pia mater. Arachnoid and dura is meeting at the level of S2. So therefore, we can do the lumbar puncture at the level of L3 and L4. So between L3 and L4, you can do here, sir. Okay, now? Are you understanding me, sir? So in the in the spinal cord topic, sir, these two things you have to learn. That's all. That is more than enough. So the extent of the spinal cord, after that, the ending part here. And please, my dear friends, no need of wasting your time in learning silly things like what is the shape of the spinal cord, it is cylindrical, what is the length of the spinal cord and all. All those things are not asked nowadays in your exam. So अगर ये दो topics पढ़ लोगे आप, that's also it is done. ठीक है ना? This is about the revision of the spinal cord topic here, sir. Now, after this one, let us move on to the next topic, that is brainstem. And I want all my dear students, to please pay attention here right now. 200% concentration here, sir. Why? Because now we are going to start with brainstem. And in brainstem topics, sir, there will be a definite question in your MC exam, guaranteed, sir. I'm not even telling expected here. I'm telling you pakka question, definite question. मतलब सवाल आना ही आना है यहाँ से एक सवाल पक्का आना है ऐसे ब्रेनस्टेम से ठीक है ना now I cleared FMG exam but still came to see Dr. Azam sir. Thank you Dr. Jamal. God bless you with a lot of success. Sir, please take biochem revision also. Yes, Ayush Jain, no problem with that one. Cleared my FMG 2020 but still came to love your way of teaching here. So thank you. Crumpled paper. Wow, what a name. Now, my dear friends, welcome here. Let's get started right now, sir. अब start करते हैं. In the brainstem, first of all, this one here will be your midbrain. And this big structure here will be the pons. And this one will be the medulla oblongata, sir. So there will be midbrain, pons, and the medulla. Now the first thing that you have to understand here is that okay, how many cranial nerves are going to begin from the brainstem? 3 to 12. How many cranial nerves are going to begin? 3 to 12, sir. So from the midbrain, there will be third nerve here. And this one here will be the fourth nerve here, sir. So from the midbrain, there will be third nerve and the fourth nerve. And please appreciate in this diagram here itself, sir, the fourth nerve is the only cranial nerve which is having dorsal origin. That is the reason why you can clearly see here. It's originating dorsally, then taking a turn, and then coming in the front, sir. Understanding? So third and fourth nerve is going to begin from midbrain. And remember, the fourth nerve is the only cranial nerve having dorsal origin. It will take a turn and then come in the front there. You can clearly appreciate in our diagram. Acha, क्योंकि ये इतना घूम कर आ रही है, it's taking a turn and coming in the front. That is why it will be having the longest course. It is having the longest intracranial course. So fourth nerve is the one which will be having the longest intracranial course. And then one more point, if you want to remember here, my dear friends, remember that the fourth nerve will also have internal decussation. Now, by the way, what is the meaning of decussation here, sir? What is the meaning of decussation in your anatomy? Remember, decussation means crossing. तो प्लीज आप वहां पर ना कहीं पर लिख लीजिए, राइट डाउन योरसेल्फ देयर इटसेल्फ इन द कॉर्नर ऑफ द पेज, decussation means what? Crossing. And remember, the fourth nerve is actually going to cross inside the midbrain only. That's the reason why Andukosam Dani internal decussation antaru. That is the reason why it is known as internal decussation. It's crossing inside the midbrain. After crossing inside the midbrain, then it is actually coming out, sir. Then coming out. Okay, fine here. Chali, badhiya. Now this one will be the pons, and from the pons, you can clearly see this nerve coming out here. This will be the fifth nerve, sir. That is your trigeminal nerve. Trigeminal nerve is coming out from the pons. And to be very, very specific here, sir, to be very specific here, this one will be actually the pons here. And this pons is going to join with the cerebellum behind with the help of this peduncle that you are able to see here, sir. And that peduncle is known as the middle cerebellar peduncle. What is this peduncle here, sir? Middle cerebellar peduncle. So therefore, my dear doctors, remember very carefully, fifth nerve is exactly coming out at the junction of pons and the middle cerebellar peduncle. So don't just say only it is coming out from the pons. To be very, very specific, fifth nerve kahan se aa rahi hai, sir? Fifth nerve is going to come out from the junction of pons and the middle cerebellar peduncle, not cerebral, cerebellar peduncle. ठीक है ना? अब यार ये तो सबको पता है, अगर pons और medulla होगा, this junction will be the pontomedullary junction. And right at the pontomedullary junction, you can clearly see here, this is the cranial nerve number 6, and then the cranial nerve number 7, and the cranial nerve number 8. So the 6th and 7th and 8th nerve will be coming out at the pontomedullary junction, sir. Coming out at the pontomedullary junction. ठीक है ना? Exactly in the middle here, there will be sulcus. और अगर यहाँ sulcus होगा, on either side will be having elevation. This elevation is known as the pyramid here and the pyramid here. And this is olive and olive here, sir. Now, just lateral to the olive here, there will be 9th nerve and the 10th nerve and 11th nerve coming out. So 9th, 10th and 11th will be originating or coming out lateral to pyramid. And between the pyramid and olive, this will be the 12th nerve, sir. 12th nerve, your hypoglossal nerve will be coming out between the pyramid and olive, sir. Are you getting the clarity now? So let me even write down the full form here, sir. This elevation here will be known as olive. And this elevation here will be known as the pyramid, sir. Lovely. Are you understanding me? So in this manner, my dear friends, first of all, let me just revise this again for you people here. Okay, how many cranial nerves are going to be originating from the brainstem? How many, cranial nerves are going to begin from the brainstem? Yes, 3 to 12, and hence it is proved here, sir. So third and fourth nerve is going to begin from midbrain. Fifth is coming out between the pons and the middle cerebellar peduncle. And 6th, 7th, and 8th will be coming out between the pontomedullary junction. And then 9, 10, 11 lateral to the olive. And then 12th is going to come out between the pyramid and olive, sir. 12th is coming out between pyramid and olive, sir. Okay, now, next one. Now, after this, my dear friends, you also have to remember कि यार ये olive form क्यों होता है? Why this olive is elevated there? Remember, अगर मान लो कि like my hand here is like olive here, sir. This is like elevation here. If you have to see just inside that one, just beneath that one. If you see beneath that one, there will be actually the inferior olivary nucleus. Which nucleus? Inferior olivary nucleus there. And because of that nucleus, it will be elevated on the surface there. Okay. And the pyramid will be actually elevated due to the pyramidal tract there, sir. Okay, now? So please write down there. Olive will be elevated due to what, sir? Due to inferior olivary nucleus. And pyramid will be actually elevated due to the pyramidal tract, sir. क्योंकि यहीं से क्या होता है? Pyramidal tract pass होता है, sir. Are you understanding me? So in this manner, all these points you have to remember in this diagram here, sir. Perfectly done. Are you understanding, my dear friends? Are you getting the clarity in the concept here? So third and fourth nerve will be originating from the midbrain. Fifth is coming out between the pons and middle cerebellar peduncle. 6th, 7th, and 8th is coming out between the pontomedullary junction. 9, 10, 11 lateral to olive, and 12th is coming out between the pyramid and olive, sir. Okay, now. And I want you to add one more point here. 9th, 10th, and 11th nerves, sir. These three nerves will be having a common nucleus. And the common nucleus of 9th, 10th, and 11th is known as nucleus ambiguous, कहते हैं, sir. That is nucleus ambiguous. That was also asked in the exam. कि nucleus ambiguous is the common nucleus of 9, 10, 11. Yes, Dr. Abhishek, absolutely correct. Fine. Now, after learning all this structure, let me take your concentration here. Now, my dear doctors, what is this crossing here? This crossing here will be the optic chiasma. And then after that optic chiasma, what is this tract here, sir? Let me just write down here itself. This is optic chiasma. And then you're able to see the optic tract here. And this one is the optic tract here. And this one will be the cerebral peduncle. And same thing on the other side also here. Also, you'll be able to find the cerebral peduncle here, sir. So the crossing will be optic chiasma, and then you'll be having optic tract, and this will be the cerebral peduncle. And now, because there is a cerebral peduncle on one side and on the other side, in between the two cerebral peduncle, you are able to find a depression. And that depression is known as fossa. Interpeduncular fossa. Look at that name. Very meaningful name, sir. Intermediate, in between, darmiyan mein, madhyalo. So in between the two cerebral peduncles, you are able to find the interpeduncular fossa. Now, what are the contents of interpeduncular fossa? Yes, this is infundibulum here. Infundibulum will be attaching to the pituitary gland, but it is cut there. This one here will be the mammillary body here, sir, and mammillary body. This one again here will be the posterior perforated substance here. And then this is the cranial nerve number 3 here, sir. Okay, and all these are the contents of interpeduncular fossa. And yes, let us cross check here, sir. So what will be the contents of interpeduncular fossa? Number one, you're able to see here, there is infundibulum. Just behind that, there will be mammillary body. And just behind that, there is a perforated substance. So that is posterior perforated substance. And then there will be the cranial nerve number 3, the third nerve, that is your oculomotor nerve. These are all the contents of interpeduncular fossa. The fossa which is present between the two peduncles here, sir. Crystal clear concept. Are you understanding me? And now, my dear friends, if you all are able to see this ventral aspect of the brainstem, all my students listening to me here, my dear friends, you are like perfect with every structure, each and every structure on the ventral aspect done here, sir. So we are done with the ventral aspect of the brainstem, all the cranial nerves originating from there. We are done with the concept of interpeduncular fossa. One more topic is done here itself. We are done with the concept of olive and pyramid also. So many topics are covered in less time and in one diagram itself, sir. Nothing to learn like separate here. So are you understanding the benefit of attending this rapid division here, sir? Thank you. Thank you, Navneet. Now, if you allow me, let us discuss like one more thing over here, sir. अरे यार ये बताओ, ये जो पिरामिड है ना, तो ये पिरामिड क्यों फॉर्म हो रहा है? Why it is elevated, sir? Why is this pyramid elevated here, sir? Because of the pyramidal tract, sir. Now, can you please tell me the pyramidal tract is actually ascending tract or a descending tract, sir? Pyramidal tract is an ascending tract or a descending tract? Thank you, Navneet. Prince Yadav, sir, repeat kar do. Already मैंने अभी repeat किया, sir. We have actually repeated just now all the cranial nerves multiple times. Almost 3 times we have repeated. Yeah, Lokesh. Very good. Very nice. Pyramidal tract is a descending tract. So now observe here, sir. Pyramidal tract is going to descend down from your cerebrum, the midbrain, pons, medulla, वो descend हो रहा है. तो यहाँ से आपका मान लो कि pyramidal tract descend हो रहा है. Now that pyramid, that is why it is elevated there. Are you understanding? Why is this elevation? Because of the pyramidal tract descending. Now from this, what is going to happen? The pyramidal tract, 85 to 90% of the fibers are going to cross on the other side. Wow. Have you ever observed this diagram very closely? 1 second, I'll remove this. Have you ever observed this diagram very closely? Can you see this crossing here? आपने कभी देखा है वो crossing है वहां पर? That is nothing but pyramidal decussation. That is pyramidal decussation. पता नहीं आपने कभी observe किया है कि नहीं? तो in the pyramidal tract, 85 to 90% of the fibers are crossing on the other side and going from here. And the remaining 10 to 15% of the fibers will remain on the same side. Wow. So therefore, my dear friends, all of you know very well that pyramidal tract. What is the another name of the pyramidal tract, sir? It is also known as corticospinal tract, sir. It is coming from the cortex and going down to the spinal cord. आपने ही मुझे बताया ना कि this is a descending tract here, sir. The pyramidal tract is actually a corticospinal tract. But now, after this crossing here, this one will be known as the lateral corticospinal tract. It will have how many fibers? 85 to 90% of the fibers. Are they crossed or uncrossed fibers? Crossed fibers. And then this one here will be the anterior corticospinal tract. And it will have how many fibers? 10 to 15% of the fibers. Crossed or uncrossed fibers? Uncrossed fibers. They're remaining on the same side. You can very, very clearly see in my diagram here, sir. Crystal clear. So pyramidal tract is known as corticospinal tract. We are done with another name. How many types are there? There are two types, lateral and anterior. Lateral will have how many fibers? 85 to 90% of the fibers, and they are crossed. They're coming from the other side. An anterior corticospinal tract will just have 10 to 15% of the fibers, and they are actually coming from the same side only. They're remaining on the same side only, sir. Uncrossed fibers. Are you understanding me here? And now, welcome to the hot favorite question in your MCI exam, sir. Where is the crossing taking place? And you can very, very clearly see here, crossing kahan ho raha hai? Yahan ho raha hai. I have drawn the diagram only on one side there. There will be from the other side also ना. Pyramidal tract दूसरी ओर से भी होता है. तो वहां पर क्रॉसिंग हो रहा है. और उस क्रॉसिंग को हम कहते हैं pyramidal decussation. So what is this crossing known as, sir? Pyramidal decussation. And where is this pyramidal decussation taking place? In lower medulla. This is extremely important. Please star mark. Pyramidal decussation is taking place in the lower medulla. Lower medulla में हो रहा है. वो अच्छे से आपके माइंड में प्रिंट हो जाना चाहिए. ठीक है ना? ये आपके एग्जाम में कई बार पूछा गया है. Okay. Now, so by this, almost everything regarding the pyramidal tract I've completed here itself, sir. No need to learn it separately here. But now, welcome to clinical correlation. है ना? आजकल तो injuries बहुत पूछा जा रहा है. And for clinical correlation, my dear friends, remember, your landmark should be the pyramidal decussation. अगर pyramidal tract decussation से पहले injure होगा, if it is injured before decussation, pyramidal tract is a descending tract, and descending tract will be going and controlling what, sir? The movement of the muscles. It is having the motor function. So what is going to happen? All the motor functions will be lost. It will lead to paralysis. And it is actually known as hemiplegia कहते हैं सर. तो अब मुझे आप ये बताइए, if the injury is before the decussation, then what will happen, sir? The injury is before the decussation, then what is going to happen? It will lead to contralateral hemiplegia, sir. Contralateral hemiplegia. If the injury is after the decussation, then it will be lead to ipsilateral hemiplegia on the same side. So please write down there itself, yes, clinical correlation. अगर pyramidal tract injure होगा, injury to the pyramidal tract, what is going to happen, sir? It will be of two categories. Now, if it is before decussation, decussation se pehle, then it will be contralateral hemiplegia. If it is after decussation, sir, decussation ke baad, then it will be ipsilateral hemiplegia, sir. अच्छा, by the way, what is the meaning of after decussation, sir? Already मैंने आपको बताया है, decussation कहाँ पर हो रहा है? Decussation is taking place in the lower medulla. So after that lower medulla, immediately what do you have there, sir? You'll be having a spinal cord only. So that means after the decussation means what, sir? The injury is taking place in spinal cord, and that will also come in your Brown-Sequard syndrome. तो इसीलिए when we discussed about the Brown-Sequard syndrome, okay ना, in doctoral app and in even the offline classes जब हमने discuss किया था, yes, there will be ipsilateral hemiplegia will occur, sir. चलिए मैं एक बार दोबारा रिपीट करता हूं crystal clearly, neat and clearly, sir. If the decussation occurs before, if the decussation occurs before the, sorry, if the injury occurs before the decussation, then it will be contralateral hemiplegia. And if the injury occurs after decussation, then it will be ipsilateral hemiplegia. ठीक है ना? Contralateral loss of pain and temperature. भाई साहब पेन एंड टेम्परेचर कहां से आ गया यार? ओ डॉक्टर साहब, ओ डॉक्टर साहब, पेन एंड टेम्परेचर कहां से आ गया? We are actually learning about the pyramidal tract. Pyramidal tract is a descending tract. Descending tract will only carry the motor information. Pain and temperature यहां से नहीं आता है. चलो, thank you, sir. Thank you, thank you, thank you. Done. So each and every point regarding the pyramidal tract is also done here in the same diagram, sir. Are you understanding my planning here, sir? How we are going to do the rapid revision in the same diagram here. Chaliye. Now, welcome to this diagram here, sir. Again, it is the same diagram of your brainstem here. Hello, my dear friends. Are you understanding everything, sir? पक्का? Thank you. Now it is the same diagram of the brainstem again. Now this one here will be your midbrain here, sir. This one here will be the pons here, and this one will be the medulla oblongata. Now I want to discuss like 2 points in this diagram here. Point number one, आपको already पता है, so you already know very well. Okay, from the midbrain, which nerves are going to come, sir? Third and fourth nerve. This is the fourth nerve nucleus here, and you can clearly see the fourth nerve will be having the dorsal origin, sir. So in the exam, what happened is that they're actually marking one arrow mark here, sir, like this. What is the nerve which is found behind the midbrain? Midbrain के पीछे कौन सा nerve नजर आएगा? That is your fourth nerve, sir. Okay, but welcome to one more concept here, sir. In the pons, what is going to happen here? There will be the nucleus of sixth cranial nerve, abducens nucleus. And from the sixth nucleus, the sixth nerve is coming out. और ये तो आपको अच्छे से पता है, you people know very well कि sixth nerve is going to come out at the pontomedullary junction. Wow, you can see crystal clearly there the sixth nerve is coming out between the pons and medulla. This will be the seventh nucleus. Okay, but the seventh nerve is going to take a turn around the sixth nucleus, abducens nucleus, and then it is again coming out from the pontomedullary junction, sir. Are you understanding me? But what I am trying to teach you here, because the seventh nerve is going to take a turn around the sixth nucleus here, therefore, my dear friends, remember, there will be an elevation formed here on dorsal aspect of the pons. So on the dorsal aspect of the pons के पीछे, तो यहाँ पर elevation form होता है, and this elevation here will be known as the facial colliculus. Extremely important, sir. And facial colliculus, again, you have to remember the reason it is formed due to which nucleus? It is formed due to the abducens nucleus, sixth nucleus. If it is formed, that elevation is formed due to the sixth nucleus, then why it is known as the facial colliculus? Remember, because the seventh nerve fibers are going to take a turn around that one. The seventh nerve fibers are going to take a turn around that one, sir. Crystal clear concept. Crystal clear concept here, sir. Okay, now. So facial colliculus is formed due to what, sir? The sixth nucleus, but which nerve fibers? That is the seventh nerve fibers. इसीलिए अगर मान लो कि यहाँ पर इंजुरी होता है, if there is an injury here, sir, they will be marking one arrow mark here, and there is an injury at the facial colliculus. अगर facial colliculus पर injury होता है, तो what is going to affect? Sixth nucleus or seventh nerve first? You can clearly see the nerve fibers. So seventh nerve effect होगा. And you all know very well, the seventh nerve will be going and supplying to the muscles of facial expression. So muscles of facial expression will be involved there. Understanding? तो अगर चलिए लिखते हैं, let us write down. अगर facial colliculus पर injury होगा, it will be affecting or involving which muscles? The muscles of facial expression. Don't say lateral rectus, sir, because most of the students will be thinking sixth nucleus होता है, तो sixth nucleus होगा तो lateral rectus वाला involve होगा. You remember that one, ना? SO4 LR6. No. पहले क्या होता है? What do you have first? No. So what will be damaged there? No. So which muscles will be involved? The muscles of facial expression will be involved, sir. So please be very careful here. Are you understanding me? So my dear friends, what do you have behind the midbrain? Behind the midbrain, there'll be the fourth nerve coming out. The only cranial nerve having dorsal origin. And behind the pons, you'll be able to see the seventh nerve taking a turn around the sixth nucleus. And that is the reason why it is known as facial colliculus. Crystal clear concept. तो ये concept मुझे clear करना था और ये आपके एग्जाम में कई बार पूछा जा रहा है सर. तो please take care about this one here. Next one. First of all, I did not write on the heading here, sir. There is a reason for that one. Why? Because just look at this diagram and first of all, you identify it is the transverse section of. आपके ही एग्जाम में एफएमजी एग्जाम दिस इमेज वाज गिवन एंड दे हैव आस्क्ड टू आइडेंटिफाई, इसीलिए मैंने वांटेडली वहां पर ना हेडिंग नहीं लिखा है. टेल मी, इट इज द ट्रांसफर सेक्शन ऑफ. वेरी गुड डॉक्टर मारुति, इट इज मिड ब्रेन. वेरी गुड डॉक्टर दिव्या रेड्डी, मिड ब्रेन. लोकेश, शक्ति, मयंक, वेरी नाइस. मलिक, आकांक्षा, पीयूष, वेरी नाइस. इट इज मिड ब्रेन सर. फाइन. सो दिस वन विल बी द ट्रांसफर सेक्शन ऑफ मिड ब्रेन. लेकिन हम कैसे पहचानेंगे? तो अभी मैंने आपको बताया था, मिड ब्रेन के आगे इन फ्रंट ऑफ द मिड ब्रेन देयर इज अ फोसा, interpedunclar fossa. And behind the midbrain there will be this colliculi. So this structures here will be the colliculi. Okay. And this duct in the middle here, that will be the aqueduct of Sylvius. Okay. Now, no, Maruti. It is not like butterfly appearance. Butterfly like appearance will be actually for the medulla oblongata. This is midbrain here. So how to identify? Interpeduncula fossa आगे होता है, colliculi पीछे होते हैं, and बीच में aqueduct होता है. And please remember that this aqueduct is a very, very important landmark, sir. Endukante, whatever part that you are able to find behind the aqueduct, this is known as tectum. Okay, now, so whatever part you're able to find behind the aqueduct, that is tectum. And in the middle, this part here will be the tegmentum part. This is tegmentum part, sir. Okay, and then, of course, this has to be the cerebral peduncle, sir. Ye wala cerebral peduncle hoga. So in this manner, remember, my dear friends, whenever you're taking a transverse section of the midbrain, it is divided into how many parts? 3 parts, sir. Tectum, tegmentum, and cerebral peduncle, sir. Tectum, tegmentum, and cerebral peduncle. It is divided into how many parts, sir? 3 parts. Perfectly done. And in this cerebral peduncle, even they have also asked this part also, sir. Can you see this black wala part, darker part? And that gray matter is known as substantia nigra. Substantia nigra, sir. And this white matter fibers here, this one will be the crus cerebri. Crus cerebri, sir. So there will be substantia nigra, and in front of that, there will be crus cerebri. Perfectly. So are you all able to identify this one? Good. तो ये वाला सवाल आपके एग्जाम में पूछा गया था, इसीलिए मैंने दिया है. Next one. Can you please identify this transverse section now? And now, my dear friend, this is the transverse section of medulla oblongata. Sir, kaise? How to identify? Very easy to identify here, sir. In the front here, there is a pyramidal tract passing here. Pyramidal tract passing here. So therefore, this one will be the pyramid and the pyramid here, sir. Good. Then there will be olive and olive here. So this is olive here and this will be olive here. And I told you very clearly, inside will be having that crumpled paper bag shaped nucleus. That is olivary nucleus, sir. And that too, it is which olivary nucleus? Inferior olivary nucleus. Inferior olivary nucleus. And of course, you're able to see there is a ventricle here. This ventricle here will be the fourth ventricle behind. So behind the midbrain, you'll be having behind the medulla, you'll be having the midbrain, fourth ventricle there. Okay, so this is actually the transverse section of medulla oblongata. Easily you can identify here, sir. Okay, and try to identify what is that new nerve which is going to come out between the pyramid and olive, sir. So between the pyramid and olive, there will be 12th nerve coming out here, sir. There will be 12th nerve, hypoglossal nerve coming out. वो मैंने आपको बताया था. Understanding here? And by this, we are actually done with the transverse section of the midbrain and the medulla oblongata. Hope you will be able to identify. Next topic here, sir. Next topic is about the cerebellar cortex. Now, this is not cerebrum now, cerebellar, sir. In cerebellar cortex, first of all, it is divided into like 3 layers, sir. There will be the outermost layer, which is known as molecular layer. And the middle layer will be known as the Purkinje layer. And the innermost layer will be known as the granular layer, sir. Now, in these 3 layers, we'll be having 5 different types of cells. Remember, the outermost layer, molecular layer, will be having stellate cells and basket cells, sir. So, you'll be having stellate cells and the basket cells. The Purkinje layer will be just having the Purkinje cells. Okay. And innermost layer, granular layer, you'll be having granular cells, and then you'll be actually having the Golgi cell. So, I repeat that statement again. In the cerebellar cortex, you'll be having how many layers? There'll be like 3 layers. And in that 3 layers, how many types of cells? 5 types of cells. The outermost layer will be the stellate and basket cell, the middle layer, the Purkinje cell, and innermost layer will be the granular cells and the Golgi cells. Okay. And now, my dear friends, please study smartly here. Histology image diya jayega. This histology image will be given in your exam. And please look at the image and tell me the only cells which you can identify here. Which are the only cells that you can identify here, sir? Come on. Purkinje cell. Purkinje cell are the largest one and they are like, flask shaped like this here, sir. यही आप identify कर सकते हो यहाँ पर. Otherwise, the stellate, basket, granular, Golgi, ये सब आप identify नहीं कर सकते हो, ठीक है ना? So that is why study very smartly. In exam, what is the examiner going to ask you? He'll always ask you only and only about the Purkinje cells over this. ठीक है ना? Now the second point here. The stellate cells will be inhibitory, basket cells will be inhibitory, Purkinje cells will also be inhibitory, and Golgi cells will also be inhibitory. The only and only excitatory cells will be the granular cells. Understanding? So remember, cerebellar cortex is the largest collection of inhibitory neurons here, sir. Cerebellar cortex is the largest collection of inhibitory neurons. ठीक है ना? सारे neurons inhibitory होंगे. The only excitatory neurons will be the granular cells. That's all. Next one, the deep nuclei of cerebellum. How many deep nuclei do you have in the cerebellum? There are totally 4 deep nuclei. And how to remember them? With the mnemonic, doctors eat good food. Normally, I don't like the mnemonic, sir, but I'm giving you the mnemonic here. Why? Because I'll tell you one thing here. You have to remember that all the nuclei are actually arranged in the same order. So there will be dentate, emboliform, globose, and fastigial nucleus. आपको order में याद रखना होगा. And they are actually arranged in the same order, like doctors eat good food. Doctors eat good food, sir. Dentate, emboliform, globose, and fastigial, sir. Now, why I'm asking you to remember in order here? Why? Because they have recently asked in the exam, which is the medial most nucleus? Medial most is the fastigial one. Which is the lateral most nucleus? Of course, dentate. And dentate is not only the lateral most, it is the largest nucleus out of all the 4 of them. And you can very clearly see the diagram also. And sometimes what is going to happen, the emboliform and the globose are combined together, and together that is known as interpositus nucleus. Interpositus nucleus कहते हैं. Interpositus nucleus कहते हैं. Done? So that is about the nuclei of the cerebellum that you have to remember for your exams. Next one. यार अब ये ना सर्कल ऑफ विलिस कैसे फॉर्म होता है, बड़ा आसान है. यहाँ देखिए, first of all you'll be having the vertebral artery here and the vertebral artery here. They'll combine to form basilar artery, sir. And why I'm drawing the diagram on this one here? Why? Because basilar artery is in fact lying on the pons. And finally, that will be dividing into the posterior cerebral artery. So this one here will be the vertebral artery. This is the basilar artery that is dividing into the posterior cerebral artery and the posterior cerebral artery, sir. इसको यहाँ पर छोड़ दीजिए. Leave it here only, sir. And now there will be internal carotid artery from both the sides. And this will actually give rise to anterior cerebral artery, sir. This is your ACA here and ACA here. And this itself will also give rise to the middle cerebral artery here, sir. So this one here will be the MCA here, sir, and this one is the MCA here, middle cerebral arteries. ठीक है ना? Now, after drawing this diagram here, अब इनको जोड़ दो, join them together. The ACA on one side and AC on the other side will be joined by anterior communicating artery. And then already we are done with the two branches of the internal carotid artery, sir. We are done with ACA and we are done with MCA. Now welcome to the third branch, and this one will be the PCOM, that is posterior communicating artery, sir. So this one here will be the posterior communicating artery. So this is how your circle of Willis will be actually formed here, sir. Fine. तो सर्कल ऑफ विलिस में कौन से वाले आर्टरीज कंट्रीब्यूट करेंगे वो आप बड़े आसानी से बता सकते हो. विच आर्टरीज आर गोइंग टू फॉर्म द सर्कल ऑफ विलिस? Posterior cerebral artery, posterior communicating artery, internal carotid artery, anterior cerebral, anterior communicating arteries. The same thing on the other side also. These are all the arteries which are contributing for the formation of circle of Willis. Okay. And one of the oldest question which is not involved in the circle of Willis, that is your MCA. ये तो पता है. Now I'll tell you one beautiful thing here. ICA and PICA. Vertebral artery will give a branch to cerebellum from below, and this one is inferior cerebellar artery. But it is the posterior wala. So therefore, this is posterior inferior cerebellar artery. Oh, so PICA is a branch of vertebral artery. Similarly, basilar artery will also give a branch here that will be anterior inferior cerebellar artery. That is your ICA. So ICA is a branch of basilar artery, sir. And basilar artery will also give a branch to cerebellum from above, and this is superior cerebellar artery. So inferiorly, you'll be having two cerebellar arteries, ICA and PICA. But remember, PICA is a branch of vertebral, ICA is a branch of basilar. And whereas superior cerebellar artery is a branch of which one, sir? Basilar artery from above. अब यहाँ पर, the first MCQ that I want you to remember is that ICA is the one which will be giving rise to the labyrinthine branches. So labyrinthine artery will be a branch of which one? Ica, not basilar. In many of the books, it is given wrongly. Okay, it is a branch of basilar directly. No, sir. Labyrinthine is actually a branch of your Ica. Number one. And number two, you can clearly see here, this is the third nerve here, and this one here will be the fourth nerve. So third and fourth nerve are between which two arteries? That is your PCA and SCA, sir. Posterior cerebral artery, superior cerebellar artery. Wow. So that point you cannot learn later on anywhere else. बहुत दिक्कत होती है इसको याद रखने में, तो यहीं पर याद रखिए. Third and fourth nerve are coming between which two arteries there? That is your posterior cerebral artery and the superior cerebellar artery. Sir. Done. So these are the points I want you all to remember about the circle of Willis here, sir. The remaining branches and everything you already know very well. Sir. Now moving ahead with the tracts and the Brown-Sequard syndrome. हाँ, जो आप कह रहे थे ना Brown-Sequard syndrome. Welcome here, sir. Now, first of all, what is going to happen here? Pain, common temperature, common crude touch, and pressure will be entering from where, sir? All the sensory information will enter from dorsal root ganglion. After entering from here, it will go in end. Already asked in your MC exam, it will be ending in a nucleus, and that nucleus will be known as substantia. Boliye. Gelatinosa. So, first of all, the fibers are going to go and end in the substantia gelatinosa. Gelatinosa, not substantia nigra, sir. Okay, na? I can hear someone saying substantia nigra from there. अब यहां से क्या होगा? Some of the fibers are going to cross into the lateral column, and from the lateral column, these fibers are going to ascend up. Obviously, that is going to form lateral spinothalamic tract. Some of the fibers are going to anterior column, and from here they're going to ascend up, and that is going to form the anterior spinothalamic tract. And please remember that pain and temperature will be carried by लात spinothalamic tract. अगर आप किसी को लात मारोगे तो उसे दर्द होगा और उसे बड़ा गुस्सा आएगा, उसका टेम्परेचर बढ़ जाएगा. Similarly, anterior spinothalamic tract is the one, and से याद रखिए crude touch and pressure. So crude touch and pressure will be carried by anterior spinothalamic tract. That is the way how you remember. Okay. Now, what about the dorsal column tract, sir? Let me use another color here. Dorsal column tract. In the dorsal column, you'll be actually having two tracts, sir. One is your fasciculus gracilis, another one is the fasciculus cuneatus. Now, from the lower limb, some of the fibers are coming here. They're entering from the dorsal root ganglion, and directly they're going to move up. And this tract will be fasciculus gracilis, sir. If it is coming from the lower limb, definitely it will be gracilis only. And then some of the fibers are coming from upper limb, and they are going to enter here, dorsal root ganglion. And from here, again, the same thing, they're going to continue up. And that is going to form fasciculus cuneatus. The first point you remember that from the lower limb, there will be fasciculus gracilis. And from the upper limb, those fibers are going to form fasciculus cuneatus. And my dear doctors, in your MC exam, they have even asked the location of this one, sir. Which one is on the medial side, which one is on the lateral side? So can you please look at my diagram and tell me, out of gracilis and cuneatus, which is on the medial side? Out of the gracilis and cuneatus, which is on the medial side, sir? That is fasciculus gracilis. And which is on the lateral side, that will be the fasciculus cuneatus. Are you understanding here? Now, this is actually going to carry what? Your favorite functions. Number one, it is going to carry fine touch. Not only fine touch, it is also going to carry vibration sensation. Along with that, it is also going to carry stereognosis. And then it is also going to carry what, sir? Proprioception. And which proprioception it is going to carry, sir? Conscious proprioception carry करता है. Wow. Makes the thing easier. बड़ा आसान हो गया है ना, समझ में आ रहा है? तो दिस इज हाउ यू हैव टू एक्चुअली रिमेंबर अबाउट द ट्रैक्ट्स. आई एम गेटिंग माय पॉइंट हियर. तो स्पाइनोथैलेमिक ट्रैक्ट भी हो गया और fasciculus gracilis भी हो गया, fasciculus cuneatus भी हो गया. Everything is done, sir. Functions are also done here. And now welcome to the clinical correlation जो आपके एग्जाम में recently पूछा गया था. That is Brown-Sequard syndrome. Yes. So first tell me, what is Brown-Sequard syndrome It is hemisection of spinal cord. Spinal cord आधा cut. मान लो कि spinal cord यहाँ हो गया आधा cut. So then tell me, pain and temperature will be lost on which side, sir? Opposite side of the injury. Fine touch, vibration, stereognosis, and conscious proprioception will be lost on the same side of the injury, sir. Ipsilateral side, sir. So let us just cross check. Let us see this diagram here, sir. So in this diagram, you can clearly see here hemisection. यहाँ पर cut हो रहा है. अच्छा. And whatever highlighted in the brown color, loss of pain and temperature. मतलब contralateral loss of pain and temperature. And whatever highlighted here in the gray color, loss of vibration, position sense, proprioception and all. So that is ipsilateral. So the moment you look at this diagram here, sir, this diagram is nothing but what? Representing the Brown-Sequard syndrome. And exactly this diagram was given in your MCI exam. आप देख कर ही बता सकते हो. The moment you look at this diagram, you can tell here. And welcome to my anatomy rapid revision class here. You don't have to mug up this one, sir. Remember this tract. अगर ये tract याद होगा यहाँ पर, that's all. You can answer that question very easily, sir. Pain and temperature will be lost on the opposite side, whereas the fine touch, vibration, stereognosis, and conscious proprioception will be lost on the ipsilateral side, sir. So this diagram is representing what? Brown-Sequard syndrome. Are you all clear with this one? और pyramidal tract वाला तो मैंने आपको पहले बता रखा था. Pyramidal tract अगर injure होगा तो क्या होगा? Obviously, if there is hemisection of spinal cord, pyramidal tract is also gone. Then what is going to happen? There will be ipsilateral hemiplegia because it is after decussation. So after decussation, it will be ipsilateral hemiplegia, sir. Is it okay? Fine here? चलिए बढ़िया sir. So by this, all the high yield topics in the neuroanatomy are done here, sir. जितने भी सारे ना important topics थे, and I think we did not leave anything here. Brown-Sequard syndrome हो गया, tracts हो गया, circle of Willis के important branches जो आपको पता होने चाहिए वो भी हो गए, cerebellum topic हो गया, cortex and deep nuclei, and then the transverse section of medulla, midbrain, brainstem topic हो गया, spinal cord हो गया. Wow, everything is done, sir. Coronal section, sagittal section, everything in detail, done, sir. So one of the most important topic, neuroanatomy, is done in a detailed manner here, sir. Are you all happy about this one here? Crystal clear? Thank you. Thank you. The nerves which are actually coming from the cortex all the way up to the spinal cord, that will be actually your upper motor neuron. जो spinal cord से exit होंगे, that is nothing but your lower motor neurons. ठीक है ना? The fibers coming from the cortex all the way up to the spinal cord, that will be upper motor neuron, and from the spinal cord, whatever is going to exit out, that will be nothing but your lower motor neurons. I hope you got it, sir. Thank you, Dr. Malik. Thank you, Kamal Khan. Thank you, Akash. Thank you, Idris Khan. Love you too, brother. बिश्केक कब आ रहे हो सर? अभी तो वापस आए सर. चलिए. So in the neuroanatomy, thank you. In the neuroanatomy, all the topics are done here, sir. ठीक है ना? So एक बार उसको देख लीजिए सर. Just like a wow. Thank you. At the level of lesion and below the level of lesion, that will be done in the regular class, sir, in detail. अभी के लिए whatever is important, how to identify, that is what I'm telling you here. Okay ना? तो अब वो only in that one topic we cannot go like in depth, like what is happening at the level of lesion, below the level of lesion, and all those things. तो कैसे उसको ना in short याद रखना है वो मैंने आपको बता दिया. In our regular class and in the videos of doc tutorial, you can actually go and watch on the doc tutorial app there. Yes, it is given in detail there. मैंने यहाँ पर detail में discuss किया है Brown-Sequard syndrome at the level of lesion, below the level of lesion, everything is done. Okay, so you can see this. चलिए सर आगे बढ़ते हैं, head and neck start करते हैं. In head and neck, the first important thing is cranial foramen, and in the cranial foramen, you should be able to identify this foramen here, sir. This is foramen ovale. And what are the structures going to pass through foramen ovale, sir? Mnemonic is male. In male, M stands for mandibular nerve. That is the third branch of trigeminal 5-3. Accessory meningeal artery will be there, sir. Lesser petrosal nerve will be there. And then E stands for emissary veins. So male structures are going to pass through ovale. That is important. Next, number 2, this foramen here will be the foramen spinosum, sir. There will be foramen spinosum here. And from the foramen spinosum, there is one important artery passing from here, middle meningeal artery. That is important. Now why I'm teaching you this one here? Why? Because if there is a hit in this region, then what will happen? This bone will be fractured and the artery passing from here, middle meningeal artery, this artery will be ruptured, leading to epidural hemorrhage. Very, very much important, sir. Continuously आपके FMG exam में ये repeat हो रहा है question. So epidural hemorrhage or extradural hemorrhage, what is the artery involved? The artery involved will be middle meningeal artery and it is passing through which one? Foramen spinosum, sir. And after that, the next important foramen here will be your jugular foramen here. First of all, did you all study about dural venous sinuses, sir? Hello, G. Did you all study about the dural venous sinuses? Now here, there will be a transverse sinus and then there will be a sigmoid sinus coming here. That will be transverse sinus, then taking a turn sigmoid sinus. And from here, this will be the inferior petrosal sinus coming here, sir. So this sigmoid sinus and the inferior petrosal sinus, ये दोनों मिलकर together they are going to form your internal jugular vein. इसीलिए उस foramen को वहां पर jugular foramen कहा जाता है. और इनके दरमियान में, in between them, you will be actually having the cranial nerve number 9 and then 10 and then 11, sir. And all these are the structures which are going to pass through your jugular foramen. Are you understanding me? So inferior petrosal sinus, sigmoid sinus, और इनके बीच में होता है 9, 10, 11. And now let me take this picture out here, sir. Now this one here will be the jugular foramen here. Now what are the structures passing through jugular foramen? You can clearly see here, there is inferior petrosal sinus anteriorly, sigmoid sinus posteriorly, और इनके बीच में होता है 9th nerve and then 10th nerve and the 11th nerve. Perfectly done. So you have to remember all the structures in the jugular foramen, that too in order, sir. आपको order में याद रखना होगा. ठीक है ना? And one more important thing here is that out of the 3 nerves, remember, the 9th nerve is the one which will be present in a separate sheath. You can very clearly see here, sir. Whereas 10th and 11th are present together in only one sheath only. Why? Because together they are going to form vago-accessory complex. The vagus nerve and the accessory nerve, together they are going to form vago-accessory complex here, sir. Okay, na? Done, sir. Fine. So that is all about the jugular foramen here. Jugular foramen के बारे में ये पढ़ना होगा. Next one. Now in this diagram here, this H-shaped suture here will be the pterion, sir. What is this H-shaped suture here, sir? Pterion. ठीक है ना? रुजैना 826 एनर्जी वीक लग रही है सर, पूरे जोश के साथ पढ़ाओ यार. अच्छा जी, ठीक है जी, ओके जी. आपको एनर्जी कम लग रही है. ओके डॉक्टर साहब. चलिए जी. So now what is this H-shaped? What is this H-shaped suture? वही तो मैं कह रहा हूँ, फायर फ्रॉस्ट. सर फुल ही है, पता नहीं कितनी एनर्जी चाहिए इनको. थैंक यू, थैंक यू भाई साहब. कॉन्सेप्ट्स पर कॉन्सेंट्रेट करो. And how is the things becoming like easier? Concentrate on that one. How to learn, concentrate on that one. Energy से क्या करना है भाई? और क्या करूं मैं? Should I come out of the screen? ये क्या हो रहा है? One sec. Thank you, Shakti. हाँ जी. Now this H-shaped suture here is known as the pterion, sir. Pterion is actually formed between the 4 bones, sir. Now this bone here will be actually the frontal bone here, sir. And this one here will be the parietal bone here. And this one here will be the temporal bone. And which part of the temporal bone? Squamous part of the temporal bone. And this one here will be the sphenoid bone here, sir. And this sphenoid, this will be the greater wing of the sphenoid, sir. Okay, now. So there will be a frontal and then the parietal and then the sphenoid. Which wing of the sphenoid? Greater wing of the sphenoid. And then the squamous part of the temporal bone. So between these four bones, what is going to happen? They will be actually the H-shaped suture formed, sir. And that suture is known as the pterion. And in your exam, what they're asking is, what will be the deep relations of pterion, sir? Pterion ke relations kya honge? Now, just deep to the pterion, what do you have here, sir? First of all, yes, every student knows this very perfectly. There will be middle meningeal artery passing from here. But remember, which division of the middle meningeal artery? That is the anterior division of the middle meningeal artery. And in your FMG exam, they have given like frontal division, sir. So please remember both the names. So anterior division or the frontal division of middle meningeal artery yahin se pass hota hai. Then apart from that, yes, my dear friends, here there will be actually the cerebral hemisphere. And in the cerebral hemisphere, this fissure here will be known as the Sylvian fissure, sir. So Sylvian fissure bhi yahan se pass hota hai. Inside that Sylvian fissure, you'll be having the middle cerebral vessels, and that is also passing from there, sir. Understanding? So all these are the structures lying deep to pterion. ये सारे structures pterion के relations में होते हैं. Perfectly done. Next one, sir. So you can clearly see in this diagram here. This one here will be the pterion. And what is lying deep to the pterion, sir? Which artery? Middle meningeal artery. But which division of the middle meningeal artery? Anterior or the frontal division of the middle meningeal artery? Not the posterior division, sir. Okay. And yes, of course, in last July exam, they have given a question from here. अगर यहाँ पर hit होगा, then what is going to happen? Fracture. और यहीं पर होता है आपका epidural hemorrhage involving which artery? The artery will be the middle meningeal artery. And that middle meningeal artery is the one which is passing through foramen spinosum. It is going to pass through foramen spinosum, sir. Are you all clear with this one here? Oh, Dr. Saab, are you clear with this one here? Chaliye, badhiya, sir. Next concept right now. Muscles of mastication. In total, how many muscles of mastication do you have? You'll be having like 4 muscles of mastication here, sir. There are totally 4 muscles of mastication. And you should be able to identify here, sir. Now, this one here will be the masseter muscle here, sir. What is this one here? Hanji. This one here will be the masseter muscle here, sir. हाँ, वो actually wrongly मेरे से वो press हो गया था. Actually वो video वाला off हो गया था मेरे साथ मेरे हाथ में ना. हाँ. So this is masseter here. This one will be the temporalis here, and this one here will be the lateral pterygoid muscle, and this muscle here will be medial pterygoid. These are the 4 muscles of mastication, sir. Muscles of mastication, 4 of them: masseter, temporalis, lateral pterygoid, and the medial pterygoid. Yes. Is it okay? Done? Now, after that, you have to actually learn about the nerve supply. So remember, all the 4 muscles of mastication are supplied by which nerve? Of course, mandibular nerve. Trigeminal ganglion will be dividing into 3 branches: ophthalmic, maxillary, mandibular. Muscles of mastication kahan hai? Niche. So which branch is coming there? Mandibular. Easy to remember. Which is the only muscle which is helping in lowering the jaw? Lowering the jaw is done by lateral pterygoid. Remember L for L, sir. So lowering the jaw is done by lateral pterygoid. And lowering the jaw, हम इसको क्या कह सकते हैं, sir? Depression of mandible. And not only depression of mandible, we can even say opening the jaw. So opening the jaw or lowering the jaw or depression of mandible, that will be done by lateral pterygoid. Temporalis is the one which is actually helping in 2 functions, sir. Number 1 function, these fibers are helping in elevation of the mandible. Elevation of the mandible. And these fibers are actually helping in retraction of the mandible. If both the options are given, remember, elevation will be better than retraction. I repeat again, temporalis के 2 function होते हैं. One is elevation, another one is retraction. अगर दोनों भी option दिया जाएगा, better option will be elevation than retraction, sir. And temporalis is the only muscle, only one muscle, which is actually doing the retraction, sir. And please don't get confused with this muscle over here. This is actually your buccinator muscle. And buccinator muscle is not a muscle of mastication directly. It is actually the accessory muscle of mastication, sir. Buccinator is accessory muscle of mastication. ये भी आपके एग्जाम में पूछा गया था. So please remember all these points here, sir. Let me remove one more time here. Now, my dear friends, everyone here, how many muscles of mastication do you have, sir? 4. Out of the 4 muscles of mastication, which is helping in opening the jaw? Lateral pterygoid. Which is helping in retraction of the mandible? Temporalis. But temporalis के दो function होते हैं, elevation और retraction, ठीक है ना? So elevation is a better option when compared to retractions. And which is the accessory muscle of mastication? That is buccinator. Buccinator is the accessory muscle of mastication. Are you perfect with this one here? All these points you have to learn here. And main importantly, you should be able to identify the muscle, sir. Recently in the NEET PG exam, they have given lateral pterygoid to identify here. Lateral pterygoid आपको identify करना होगा. Muscles of tongue. Please write down there. Pakka definite question in your MCI exam, sir. Definitely, pakka एक सवाल यहाँ से आएगा. So first learn the 4 extrinsic muscles of tongue, sir. This muscle will be known as genioglossus. This muscle is coming from styloid process, styloglossus. This muscle is coming from the palate above, palatoglossus. And below this muscle is actually from the hyoid bone, that is hyoglossus. आगे, पीछे, ऊपर, नीचे से. Okay ना? तो genioglossus, styloglossus, palatoglossus and hyoglossus. These are the 4 extrinsic muscles. अब यहाँ से remember 3 questions here, sir. Which is the largest muscle of the tongue? Genioglossus. Which is the safety muscle of tongue? Genioglossus. ये आपके एग्जाम में बहुत बार पूछा गया है. Genioglossus is the safety muscle of the tongue, sir. And remember, palatoglossus is not a true muscle of tongue. And ये तो याद रखना बड़ा आसान है. Very easy. Why? Because, hello जी. Why? Because नाम में ही लिखा है palatoglossus. It is the muscle of the palate also, and it is the muscle of the tongue also. So therefore, it is not truly the muscle of the tongue, sir. It is not truly the muscle of the tongue. Is it okay? Palatoglossus. So muscles हो गया. And now welcome to the nerve supply of the tongue, sir. और recent जुलाई एग्जाम में भी nerve supply पूछा गया था. अगर आप लोग previous year questions देख रहे हो, PYQs देख रहे हो ना, तो आपको पता होगा. Recently in the July exam, they have asked about the nerve supply of tongue, sir. Anterior 2/3, है ना? हाँ. So now please write down there in your notebooks, nerve supply of tongue. Let us do it in detail. Nerve supply of tongue will be divided to 2 categories, sir. Number 1, there will be motor supply, and then you'll be having the sensory supply. Motor means what, sir? To the muzzle. So remember, all muscles of tongue will be supplied by 12th nerve, hypoglossal nerve. All the muscles of tongue will be supplied by hypoglossal nerve. Except which muscle? So except, remember, it will be palatoglossus. And palatoglossus will be supplied by vago accessory complex. So all the muscles of tongue will be supplied by 12th nerve except the palatoglossus, and palatoglossus will be supplied by vago accessory complex. Is it clear? Yes, of course. It is crystal clear concept here, sir. Now welcome to the sensory supply. Sensory supply of tongue is again divided to 2 categories here. One will be special sensation, and the special sensation from the tongue will be the taste, and then another one will be the general sensation, sir. यही तो पंगा है. Now we have to remember like two nerves, sir. Which nerve is going to carry special? Which nerve is going to carry general, sir? Yes, very good, Dr. Syed Asif. Very good, Dr. Abhishek Mishra. Very nice. You remember my trick. How to remember the sensory supply. Draw the diagram of tongue like this here. And then we all know tongue will be divided into anterior 2/3, posterior 1/3, and then the posterior most part. After drawing like this, write down there as 5, 7, and then 9, 9, and then 10, 10. Anterior 2/3 of the tongue, the taste sensation, special sensation taste will be carried by which one? The 7th nerve. And of course, which branch of the 7th nerve? Chorda tympani branch. chorda tympani branch of the seventh nerve is going to carry the taste sensation from the anterior two-third. July exam question. And from the anterior two-third, general sensation will be carried by the fifth nerve, trigeminal nerves. Now, 1 second, look at me how to learn about this one, sir. The fifth nerve, trigeminal nerve, will be actually giving three branches here: ophthalmic, maxillary, mandibular. And we are learning about which topic right now, sir? Tongue. तो tongue कहाँ है? नीचे. तो नीचे कौन सा वाला branch जाएगा? Mandibular nerve जाएगा. So fifth nerve, trigeminal nerve, which branch? Mandibular. Mandibular nerve will give like many branches. Which branch will be going to the anterior to third? Lingual branch. So tongue के लिए lingual होगा. Understanding your point here? So now learn in a retrograde manner. General sensation from the anterior two-third is carried by lingual branch of mandibular nerve of trigeminal nerve. The lingual branch of the mandibular of the trigeminal, sir. In this manner, you have to actually learn the general sensation from the anterior two-third. Okay. Now, after learning this one, my dear friend, let me give you one exception here. There is circumvallate papillae here. तो circumvallate papillae में क्या होता है? What do you have there? Of course, it is going to carry taste. It will be having taste buds. But the problem is that even though it is present in the anterior two-thirds, even though it is present in anterior two-third, the taste from the circumvallate papillae is not carried by seventh nerve. Listen to me with all your ears open. The taste sensation from here will be carried by ninth nerve, sir. Which nerve? Ninth nerve. Glossopharyngeal. The ninth nerve is the one which is going to carry the taste sensation from the anterior two-third of the tongue, sir. The anterior two-third of the tongue, taste will be carried by seventh one. But from the circumvallate papillae, it is carried by ninth one, sir. Please remember that. अगर आपको ये याद हो गया है, if you have learned this one, after that, no tension at all, sir. Posterior one-third, it will be carried by ninth nerve, glossopharyngeal nerve. And posterior most part, it will be carried by 10th nerve, sir. That is your vagus nerve, guys. Are you getting me? Very easy. Okay, bachcho. Are you done? So this is like very much important for your MC exam, sir. So tongue topic से एक सवाल ना पक्का आता है. One question for sure from your tongue topic, sir. Are you getting me? अब बढ़ते हैं आगे, sir. Next one, next concept, dural venous sinuses. Now in this diagram, this one here will be the superior sagittal sinus. This one here. And then this one here below will be the inferior sagittal sinus. The one which is below here. And these two are actually connected by what, sir? These two are actually connected with the help of the straight sinus here, sir. This one will be the straight sinus. And from below here, which sinus is going to come here, sir? That is your occipital sinus coming here. So all the sinuses are going to meet here. That is nothing but confluence of sinuses, sir. So there will be superior sagittal sinus, inferior sagittal sinus, and then this is the straight sinus. And from below here, there will be occipital. All the sinuses are meeting there, and there is confluence of sinuses. And after meeting there, what is going to happen? It's going to move away. The blood is going to move away from here. Transverse sinus, this is sigmoid sinus, combining with inferior petrosal. Together, it is going to form the internal jugular vein. ये तो मैंने आपको already पहले ही पढ़ा रखा है. Now, why am I teaching you this one here right now? Why? Because in your exam, they have given a transverse section at this level. If there is a transverse section is given here in this manner, try to identify that sinus. Which sinus is this one here, sir? In the transverse section, that sinus is nothing but your straight sinus. So which one is that one? Straight sinus. So please remember, in the transverse section, this sinus here will be actually your straight sinus here, sir. Are you understanding your point here? Now, one more point I want you to remember here is this straight sinus is actually the continuation of this vein here. And that vein is known as the great cerebral vein of Galen, the vein of Galen. The vein of Galen will continue into the straight sinuses. The vein of Galen, sir. Galen will be continuing into the straight lines. Perfectly done. तो ये MCQs यहाँ पर cover हो चुके हैं सर. आगे बढ़ते हैं. Now in this diagram you are able to see transverse section of the neck. In transverse section of neck में आप सबको already fascia वगैरह तो already पता है. The deep fascia, superficial fascia of the neck and all, we have already covered like many times. The important thing right now, what I want you to learn is the nerves. How to identify the nerve. Now, please look at this diagram here. This nerve here will be the recurrent laryngeal nerve. It will be present between the tracheo-esophageal groove. That's how you have to identify it. Now, this nerve here will be the vagus nerve, sir. How to identify that this is vagus nerve only? It is present inside the carotid sheath. Then behind the carotid sheath, you are able to see this one here. That is your sympathetic trunk, sir. तो sympathetic trunk कहाँ होता है? It is behind the carotid sheath, sir. There is a posterior relation of the carotid sheath, sir. Carotid sheath के पीछे क्या होता है? Sympathetic trunk होता है, sir. ठीक है ना? And after that, my dear friend, in this diagram, this muscle here will be scalenus anterior muscle, and this is scalenus medius muscle, sir. In between the scalenus anterior and the medius, this one will be the brachial plexus. In front of the scalenus anterior, this one here will be the phrenic nerve. और ये बहुत important है आजकल. Nowadays a trending question in the exam, sir. Okay. So in front of the scalenus anterior, there will be actually the phrenic nerve. So phrenic nerve उसके सामने होता है. So in this manner, you should be able to identify all the nerves. मैं एक बार दोबारा repeat करता हूँ. I'll repeat once more here. In the tracheo-esophageal groove, you'll be having recurrent laryngeal nerve. Inside the carotid sheath, you'll be actually having the 10th nerve, sir, vagus nerve. ठीक है ना? Behind now behind the carotid sheath, there will be actually the sympathetic trunk, sir. And then in front of the scalenus anterior, there will be phrenic nerve. In between the scalenus anterior and the scalenus medius, there will be brachial plexus, guys. ठीक है ना? Is it okay? Is it okay, my dear friends? So in this manner, you should be able to identify all the nerves here, sir. Or yes, you can see here the beautiful carotid sheath here. The carotid sheath, mein, sir, the most important thing in the carotid sheath will be the content. This one here will be the internal jugular vein here. Okay. Then this one here will be the carotid artery. But be very careful here. Only the common carotid artery and internal carotid artery will be the content of carotid sheath, not the external. External बाहर चला जाता है. और दोनों आर्टरी और वेन के बीच में क्या होता है? There will be a vagus nerve, sir. Okay ना? Vagus nerve होता है. Is it okay? Come on, yaar. Tell me fast. So inside the carotid sheath, there will be internal jugular vein, common carotid artery, then internal carotid artery, and between the artery and vein, there will be the vagus nerve, sir. Done. So this part is also completed here. Now moving on to the next topic here. And this is nowadays the hot favorite topic of your MC examiner. Okay. This is actually the posterior triangle of the neck. And in the posterior triangle of the neck, you're able to see all the 4 nerves there. The 4 cutaneous nerves here, sir. This one will be the lesser occipital nerve. This one here will be the great auricular nerve. And then the transverse cervical nerve. It is going transversely in the neck region. And this one here will be the supraclavicular nerve. They're going above the clavicle. Lesser occipital, great auricular, transverse cervical, supraclavicular. And out of all these nerves here, the great auricular nerve is nowadays very much important, sir. In the coup. Why? Now, in this diagram, remember, it is supplying to what? The great auricular nerve will be supplying to skin of angle of mandible. So the skin over angle of the mandible will be supplied by the great auricular nerve, and even the lobule of the ear. The lobule of the ear is also supplied by the great auricular nerve. So great auricular nerve will be supplying the skin over the angle of the mandible, and then, my dear friends, yes, there will be there will be actually the lobule of the ear that is also supplied by great auricular nerve. ठीक है ना? एंड अपार्ट फ्रॉम दैट रिमेंबर ग्रेट ऑरिकुलर नर्व, आपके एमसीए एग्जाम में ना एक बारी फ्रेज सिंड्रोम के बारे में पूछा गया था, फ्रेज सिंड्रोम. नाउ माय डियर डॉक्टर्स, हेलो जी, कैन यू प्लीज टेल मी इन फ्रेज सिंड्रोम विच नर्व विल बी इंज्यूर्ड, which nerve will be injured sir, in the Frey syndrome? In the Frey syndrome, which nerve will be involved, sir? Come on, come on, come on, quickly. अरे यार. No, 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 no. Frey syndrome. हाँ. The nerve damaged or injured in the Frey syndrome will be auriculotemporal nerve. That is auriculotemporal nerve. And that is going to most commonly come and join with which one? The great auricular nerve. Please have a clarity. इसीलिए तो मैं पूछ रहा हूँ आपको. That's the reason why I'm actually asking you here, sir. Understanding your point here? The auriculotemporal nerve will be actually injured. I'm telling you once more. That is most commonly joining with what? So great auricular nerve. इसीलिए क्या होता है? Whenever this auriculotemporal nerve will be actually stimulated, what is going to happen? It will go and stimulate the great auricular nerve. And great auricular nerve will be supplied to the skin over here. तो जब भी बंदा खाना खाएगा, तो in this region there will be redness and sweating will occur. And that is known as the Frey syndrome, sir. Gustatory sweating. Gustatory sweating कहते हैं सर. तो देखिए सर कितने इंपॉर्टेंट क्वेश्चंस यहाँ पर. The skin over angle of the mandible, the lobule of the ear, and even in the Frey syndrome, great auricular nerve will be involved, sir. And apart from that, my dear friend, what about this nerve? This nerve here will be the 11th cranial nerve. And 11th nerve is accessory. और ये वाला कौन सा component है? Spinal accessory nerve. Spinal accessory nerve, sir. ठीक है ना? ठीक है ना? So what is that nerve, guys? That is your spinal accessory nerve here, sir. Now this spinal accessory nerve will be actually supplying to two muscles here, sir. One will be the trapezius muscle and sternocleidomastoid muscle here, sir. So this trapezius muscle over here and the sternocleidomastoid muscle, ये दोनों भी कौन supply करेगा? Spinal accessory nerve supply करेगा. Now, my dear friend, please remember here, what is the action of the trapezius muscle, sir? ठीक है ना? Thank you, Dr. Ali. Trapezius muscle, my dear friend, look at me here. अगर ये trapezius muscle होगा, if it is going to contract here, it will be helping in shrugging of the shoulders. Shrugging of shoulders. And the fibers present behind will be actually helping in retraction of the scapula. Retraction of the scapula. And then please recall the upper limb topic. In upper limb topic, I hope you all have learned about overhead abduction above 90 degrees. That is done by trapezius only, sir. So please remember the three actions of trapezius here, sir. Number one, it is helping in shrugging of the shoulder. Shrugging of shoulder. And number two, it is helping in retraction of scapula. And number three, it is helping in overhead abduction of arm. Please write down completely this, sir. So trapezius is helping in shrugging of the shoulder, retraction of the scapula, and overhead abduction of the arm, sir. And yes, my dear friend, in the July exam, they have given an image-based question. Yes. अगर मान लो कि trapezius paralyzed हो जाता है, if this trapezius muscle is gone, then what is going to happen? You cannot shrug the shoulder. Forget about shrugging the shoulders will drop. So drop shoulder will occur due to paralysis of trapezius one only, sir. And which nerve is supplying to trapezius? 11th cranial nerve, that is gone, sir. Spinal accessory nerve will be gone, sir. ठीक है ना? हाँ. Yes. Thank you, Thakur. Who is this gaming? Gaming is asking, sir, ये क्लास कितने घंटे का है? Actually, ये क्लास कितने घंटे का है वो मुझे भी नहीं पता है. I am enjoying here teaching and you enjoy learning. है ना? इसमें टाइम से क्या करना है आपको? सीख रहे हो ना? If you're learning some concepts very nicely, I hope I'm not actually boring you here, making the concepts very clear. So time क्या लेना देना है? What will you do with the time? Thank you, Dr. Ali. Thank you, ji. Harsh Jain, long thoracic nerve will be supplying to serratus anterior, not here. Serratus anterior muscle, that is your boxer's muscle, long thoracic nerve, not here, sir. Thank you, Dr. Dayaraj. चलिए सर, very good, thank you. तो please remember this one, sir. तो अगर trapezius muscle involve होगा, तो there will be loss of shrugging of the shoulder, so therefore shoulder drop will occur. That is done, sir. And by this, we are actually done with what here? We are done with the head and neck, all the important topics in the head and neck cell. So cranial foramen, dural venous sinuses, all the topics in head and neck are done and done and done, sir. Okay, जी. So two big topics I have completed here, sir. So neuroanatomy हो गया और head and neck हो गया, sir. We are done with two big topics here. Understanding? Dr. Ritesh Giri, we met in Jasu. Okay, that's really nice. So we have students from all the places here, huh? Yes, Dr. Abhishek Mishra, winging of scapula will occur due to injury to long thoracic nerve. चलिए जी. When are you coming to Jasu? I'll be coming there very soon. I'm already done with the other universities also. There also I'll be coming. The moment the schedule is done, I'll be surely there. Sir, what happened to your Instagram? Actually, like I'm very busy with some work I'm doing. I'll come up with that news to you people. Don't worry about that one. तो इसीलिए मैं थोड़ा सा avoiding distraction and all. So I'm just away from all this, social media now. I'll just available only on WhatsApp. Sir, love from Kashmir. Thank you. Thank you, Ashman Call. Thank you. Thank you. Thank you, Sneha Anjali. Thank you. Chalo. Greetings from Perm. Oh, Shubham Verma. How are you, Shubham? Thank you. चलिए सर मजर शेख इज टेलिंग हैप्पी बर्थडे सर यू कैन विश मी ऑन 20th December डोंट वरी दिसंबर स्टार्ट हो गया है दिस एक्चुअली द मंथ ऑफ माय बर्थडे ओनली 20th December 20 थैंक यू तलिका थैंक यू ओके थैंक यू डॉक्टर आसिफ थैंक यू कन्वे माय रिगार्ड्स टू योर मदर आल्सो ओके फाइन चलो जी अब हम आगे बढ़ते हैं ओहो लवली 193 वेरी नाइस थैंक यू जी चलिए सर तो न्यूरोएनाटॉमी हो गया हेड एंड नेक हो गया थोड़ी सी आपके साथ में बातें हो गई अब हम आगे बढ़ते हैं सर लेट्स गो अहेड विद द नेक्स्ट टॉपिक राइट नाउ दैट इज योर अपर लिम्ब टॉपिक सर ठीक है ना समत खान इज टेलिंग यू लुक fit and fine thank you Samat Khan thank you for appreciating that one and at the same time I request all of you to pray for my health also at the same time क्योंकि हमारे यहाँ कहा जाता है अगर किसी से कुछ मांगना हो तो सेहत मांगो तो यस मेरी सेहत के लिए दुआ करिए और मैं इसी तरीके से आप लोग को हेल्प करता रहूंगा इसी तरीके से आप लोग को पढ़ाता रहूंगा चलिए जी let us go ahead right now with the upper limb topic right now and in upper limb topic there will be a definite question from the muscles of hand so let us learn about that in detail okay now in total how many muscles of hand do you have sir totally there'll be like 20 muscles of hand sir and out of the 20 muscle of hand this group of muscle below the thumb here will be the thenar muscles sir. And this group of muscle below the little finger here will be the hypothenar muscles. Okay, na? In thenar group of muscles which are present below the thumb here right now, sir, they will be number one flexor pollicis brevis, number two abductor pollicis brevis, number three they will be opponens pollicis. And number four, you'll be having adductor pollicis for adduction of thumb. Now, exactly the same on the other side, hypothenar. There will be flexor digiti minimi. Number two, there will be abductor digiti minimi. And then there will be opponens digiti minimi. And then the fourth one will be a different one. And that is palmaris brevis. Palmaris brevis, sir. Is it okay? So this will be about the four thenar muscles here, sir, and then the four hypothenar muscles over here. The flexor, abductor, opponents, ऐसे याद रख लो sir. ठीक है ना? Now I hope you all know that all the 20 muscles in hand they will be supplied by ulnar nerve and the median nerve, sir. And out of all the 20 muscles, remember, ulnar nerve will be supplying to all your hypothenar muscle, as well as it is also supplying to adductor pollicis. Very much important for your exam, sir. And whatever I marked in the pink color here, this is all supplied by which nerve? Ulnar nerve. And the remaining three thenar muscles, they will be supplied by median nerve. The three thenar muscles will be supplied by median nerve, sir. Are you understanding me? So ulnar nerve will be coming from the medial side, no, sir. Ulnar nerve is coming from the medial side here. So it will be supplying to the hypothenar muscles here, as well as it is supplying to one of the thenar, which is adductor pollicis here, sir. The remaining three of them will be supplied by median nerve. Perfectly done. Now here, I'll tell you one thing here, sir. For example, I hope you all know the book test, right? Aapko book test pata hoga. Whenever you're trying to hold any book, what will happen? Whenever you're trying to hold any book there, aap kya karoge, sir? You are actually going to adduct the thumb. Okay, now, and adduction is actually done by adductor pollicis. Let me just do like this. Not having any book here. अगर मान लो कि ये किताब है, I'm holding a book here like this, and कैसे पकड़ते हैं सर हम book? ऐसे. Look at my thumb very carefully. ऐसे. Adduction. And adduction is done by which one? Adductor pollicis. अगर मान लो ulnar nerve is injured, then what will happen? I am not able to do adduction here. तो मैं क्या करूंगा तब यहाँ पर flexion करूंगा. और जैसे आपको ये thumb bent नजर आएगा, the moment you see the thumb is bent here, it means that ulnar nerve is injured. And this test is known as what's a book test. And book test is actually done for which nerve? Come on, the book test is done for which nerve, sir? Ulnar nerve. And in this, which muscle will be involved? Adductor pollicis. So यहाँ पर book test ulnar nerve के लिए किया जाता है. Which muscle? Which muscle? Adductor pollicis. Okay. And here there is a sign which is positive, and that sign is known as what, sir? Fromm-Bent sign कहते हैं. That sign will be Fromm-Bent sign. That was a recent NEET PG exam question in 2023. 2023 में NEET PG में पूछा गया था. ठीक है ना? चलिए. After the thenar and hypothenar, let us go ahead with the lumbrical. In total, how many lumbricals do you have? 4. Lumbrical number 1, then 2, then 3, and the 4. Now, these lumbricals are going to begin from these 4 tendons here, sir. This is your FDP tendon. Flexor digitorum profundus tendons. FDP tendon. तो origin कहां से होता है? FDP tendon से होता है. And this lumbricals, you can clearly see they are going behind and getting inserted onto the common extensor tendon. Insertion will be onto the common extensor tendon. Origin will be from FDP tendon and the insertion will be onto the common extensor hood भी कहते हैं. ऐसे वो पीछे जाता है and it is getting inserted here, sir. Common extensor tendon or the common extensor hood, sir. After that, now come on, sir. Ulnar nerve is coming from here, right? So it will be supplied to third and fourth lumbrical. And median nerve is coming from here, supplying to first and second lumbrical. It's so easy. So remember, L1 and L2, these two will be supplied by median nerve. And then L3 and L4, these two will be supplied by ulnar nerve, sir. And observe one more point there. First and second lumbrical is going to originate only from one tendon. So that is why this is known as unipinnate. And the third and fourth lumbrical is going to originate from the 2 adjacent tendons. So therefore, this is known as bipinnate. Khatam. And last and final thing, what is the action done by lumbrical, sir? It's so simple. L for lumbrical and make your hand like L shape like this. F-A-S-A. Please make your hand like L shape. I can see there many students are making the hand like L shape like this here, sir. Oh, hello. ये वाला L नहीं होता है सर, वो ना, it's not like that I love you, you love me वाला, ये वाला L नहीं होता है, ऐसे L बनाना, ऐसे बाबूजी का ठुल्लू ठुल्लू ऐसे. Now in this, what is going to happen? There is a flexion at metacarpophalangeal joint, and then there will be extension at the interphalangeal joint, sir. Flexion at metacarpophalangeal joint and extension at the interphalangeal joint. That is done by lumbricals. Now the next one, the moment you look at this diagram here, sir, ये तो इंट्रोशियाई है, लेकिन कैसे पहचानोगे? You can clearly see in the very first diagram, these are unipinnate. And whichever interossei is unipinnate, that will be palmar. And whichever interossei will be bipinnate, that will be dorsal interossei. The moment you look at the diagram, the muscles are actually present between the bones only. The muscles are present between the bones only. So they are interossei. लेकिन कौन सा वाला पामार है और कौन सा वाला डॉर्सल है, कैसे पहचानोगे? जो यूनिपिनेट होगा पामार, जो बाइपिनेट होगा डॉर्सल इंट्रोशिया. And what is the nerve supplied to all the interossei? All the interossei are supplied by ulnar nerve. all the interossei are supplied by ulnar nerves. So don't even think, sir. The moment you listen the name as interossei, all of them will be supplied by ulnar nerve. Now, what is the action done by the palmar interossei? Palmar interossei are going to bring all the finger here, 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 and here. It means they are going to bring all the fingers towards your middle finger here. The palmar interossei will be helping in adduction. Dorsal interossei will take the fingers away like this. So therefore, it is going to take the fingers away from the middle finger. So therefore, dorsal interossei will be helping in abduction. तो कैसे याद रखना होगा? Pad and dab. Pad and dab. Okay ना? And now, my dear friends, actually हम यहाँ पर करेंगे कार्ड टेस्ट सर. मेरे पास में यहाँ पर कार्ड भी नहीं है भाई. है ना? हाँ. मान लो कि there is a card here. Fine. And this card here, my dear friends, it is given between the fingers. And if you are able to hold the card between the fingers like this here, अगर आप ऐसे card को hold कर पा रहे हो ना, it means that you are able to bring the fingers closer palmar interossei. That means ulnar nerve is good. The card test is actually done for which muscle? Palmar interossei, ulnar nerve. Perfect. And then for dorsal interossei, we'll be doing the Egawa test. तो एगावा टेस्ट कैसे होता है? अगर मान लो कि सरफेस है, यू आर गोइंग टू कीप योर हैंड ऑन द सरफेस हियर एंड मूव द मिडिल फिंगर ऑन बोथ द साइड लाइक दिस, ऐसे. ठीक है ना? तो दैट इज नथिंग बट योर एगावा टेस्ट, एंड दैट एगावा टेस्ट विल बी डन फॉर डॉर्सल इंटरोशियाई. आर यू अंडरस्टैंडिंग मी? तो by this, my dear friends, we are done with the 4 thenar, 4 hypothenar, 4 lumbricals, 4 palmar interossei, 4 dorsal interossei. All the information regarding muscles of hand is done. और ये अच्छे से याद रखना, पक्का यहां से सवाल आएगा. One question will definitely come from here. Okay, next one. After that, welcome to the sensory supply. On the palmar surface, the medial 1.5 digit, little finger and half of the ring finger is supplied by ulnar nerve. And the lateral 3.5 digit is supplied by median nerve. On the dorsal surface of this, also the same thing, the medial 1.5 digit is supplied by ulnar nerve. But please be careful with the lateral 3.5 distal phalanges. Dorsal surface, lateral 3.5 distal phalanges. This will be actually again supplied by median nerve. ठीक है ना? And remaining whatever is not highlighted here, that will be supplied by the radial nerves. So medial 1.5 digit is supplied by ulnar nerve. Lateral 3.5 digit distal phalanges will be supplied by median nerve, and the remaining, which is not highlighted, that the dorsum of the hand will be supplied by the radial nerve. The dorsum of the hand will be supplied by radial nerve. कोई दिक्कत? कोई दिक्कत बच्चों? Are you done? चलिए बढ़िया, आगे बढ़ते हैं सर. Now brachial plexus तो आपको यार अच्छे से पता है. Brachial plexus will be actually formed from where? C5, C6, C7, C8, and then T1. And this is going to form the roots of the brachial plexus. C5 and C6 will combine together to form upper trunk. C8 and T1 will combine to form lower trunk. And C7 will continue to form your middle trunk, sir. So in total, how many trunks do you have in the brachial plexus? There are 3 trunks, sir. Upper trunk, middle trunk, and the lower trunk. Now, all the 3 trunks will divide into division. And this is the easiest one, sir. Why? Because all the 3 trunks will divide into 2 divisions, sir. So this one here will be the anterior division, and this is anterior division. And this one here will be the posterior, and the posterior ones. So all the 3 trunks will divide into 2 divisions. One is anterior, another one is the posterior division, sir. And now, my dear doctors, combine all the 3 posterior division. Together it is going to form posterior cord. The anterior division of the upper trunk and the middle trunk will combine to form lateral cord. And the anterior division of lower trunk will continue as medial cord, sir. So in total, how many cords do you have? 3 cords. And finally, the cords are going to give rise to branches. और वो तो आपको अच्छे से पता है, branches, LML, M4U, lunar, है ना, and all those things. But now, why am I teaching you all this here? Mainly for the clinical applications, sir. क्योंकि आपके MC एग्जाम में winging of scapula बहुत commonly दिया गया है. Okay, तो please remember here, अगर upper trunk damage होगा, If there is an injury to upper trunk, it will lead to Erb's paralysis, Erb's palsy. और Erb's palsy में क्या होता है सर? What is going to happen? What is the sign? Policeman tip hand. और policeman tip hand कैसे form होता है? At the arm there will be adduction and medial rotation. At the elbow there will be extension, and at the forearm there will be pronation, and the fingers will be flexor, and that will be giving the appearance of a policeman tip hand. Okay. अगर lower trunk damage होगा, if there is an injury to lower trunk, it will lead to Klumpke's paralysis. And in Klumpke's paralysis, what is the sign? The sign will be the claw hand. और claw hand कैसे form होता है? Come on, take up your right hand like this here and do it like this here, sir. Metacarpophalangeal joint पर flexion होगा कि extension होगा? Extension होगा, and that too it will be hyperextension. And then there will be flexion at interphalangeal joint. This makes your hand like a claw hand. तो claw hand कैसे बनता है sir? Hyper extension at the metacarpophalangeal joint and flexion at the interphalangeal joints. Then after that, from C5, C6, and C7, yes, there will be a nerve beginning from here, and this nerve will be actually the long thoracic nerve. Or a long thoracic nerve, which muscle? It will be supplying to which muscle, sir? Serratus anterior muscle, sir. And if serratus anterior muscle is gone, ask the patient to push. और जैसे वो push करेगा, what is going to happen? Scapula will become like more prominent, and therefore this condition is known as winging of scapula. और ये आपके एग्जाम में कई बार image based question दिया गया है. It is given like image based question, sir, in your exam. And in winging of scapula, which border of the scapula is going to become prominent? The medial border, sir. So medial border of the scapula becomes prominent in the winging of scapula, sir. Which nerve is involved? Long thoracic nerve. Which muscle will be involved, sir? Serratus anterior muscle will be involved, sir. So done, sir. So injury to upper trunk, Erb's paralysis, policeman tip hand. Injury to lower trunk, Klumpke's paralysis, there will be claw hand. And then long thoracic nerve injury will lead to winging of scapula, sir. Next concept. Recently in the exam, they have asked about the clavicle here, sir. So this bone here will be the clavicle. Let us see the peculiarities of this one, sir. Yes, clavicle is the first bone to ossify in our body. To begin the ossification, which is the first bone to begin the ossification? Clavicle. But it is the last bone to complete the ossification, sir. First bone to begin the ossification, but the last one to complete the ossification. If you see all the long bones in our body, they are like vertical, but this is a long bone, but present horizontal. Clavicle is a long bone, present horizontal. Long bones will be having a medullary cavity, but there will be no medullary cavity inside the, even though it is a long bone, there is no medullary cavity. It is the only long bone which will be having two primary centers and one secondary centers. Normally long bone will be having one primary, but this is having like two primary centers, sir. And this is the long bone which will be ossifying from membranous. Actually, आपने orthopedics में पढ़ा होगा कि ossification will be actually of two types, sir. One will be the cartilaginous ossification, another one is membranous ossification. ठीक है ना? Now, out of that, remember, long bones will be undergoing cartilaginous ossification. They'll be forming from the cartilage. But even though this is a long bone, it is actually having the membranous ossification. And it is most commonly fractured in children. Okay, fine. And the most common site of the fracture will be the junction of medial 2/3 and the lateral 1/3. The medial 2/3 and lateral 1/3. This was the question which was recently given in your MCI exam, sir. ठीक है ना? चलिए आगे बढ़ते हैं सर. हाँ. Abduction of arm. We can do the abduction from 0 degrees to 15 degrees, then 15 degrees to 90 degrees, and then we can do the abduction above 90 degrees, sir. Another very important topic for your MC exam, sir. ठीक है ना? So now 0 to 15 degrees abduction is done by supraspinatus muscle. 15 to 90 degrees is done by deltoid muscle. Above 90 degrees will be done by trapezius, along with trapezius, serratus anterior, sir. Understanding your point here? तो abduction आपको याद रखना होगा 0 to 15, 15 to 90 and above 90 degrees से. तो 0 to 15 degrees abduction is done by supraspinatus, 15 to 90 degrees is done by deltoid, and above 90 degrees will be done by trapezius along with serratus anterior. Perfectly done. Okay ना? Next one, nerves related to humerus, sir. चलिए अब आप लोग आंसर करते जाइए सर. What is the nerve related to surgical neck of the humerus? सर्जिकल नेक के पास में यहाँ पर ना एक्सिलरी नर्व होगा. What is the nerve related to shaft of the humerus? Behind the shaft there will be spiral groove. In the spiral groove there will be radial nerve होगा सर. What is the nerve behind the medial epicondyle? Behind the medial epicondyle, ulnar nerve, sir. Okay. Is it okay? Now, so let me now ask you in the opposite manner. Hello, bacho. Now answer me here. If there is a fracture of surgical neck of the humerus, agar surgical neck के पास में fracture होगा, which nerve will be involved? If there is a fracture of surgical neck of the humerus, which nerve will be involved? Axillary nerve. If there is a fracture of shaft of the humerus, radial nerve will be involved. If there is a fracture of the medial epicondyle, ulnar nerve will be involved. But if there is a supracondylar fracture, बोलिए, अगर supracondylar fracture होगा तो कौन सी nerve involve होगी? I am seeing your answers in the chat box here. Supracondylar fracture में कौन सा? Some people are answering here median. Okay. Median nerve will be actually giving a branch that is AIN, anterior introitious nerve. That is a better option when compared to the median nerve, sir. So in supracondylar fracture, remember AIN is actually a better option when compared to the median nerve, sir. So remember the fractures. तो अगर सर्जिकल नेक फ्रैक्चर होगा एक्सिलरी नर्व, शाफ्ट फ्रैक्चर होगा रेडियल नर्व, सुप्राकॉन्डाइलर एआईएन एंटीरियर ट्रोशियस नर्व एंड मिडियल एपिकॉन्डाइल अल्नर नर्व. Perfectly done, and it is hot favorite concept of MC exam. And I hope you all remember recently in the MC exam they have given about the radial nerve, sir. There was a fracture here in the shaft of the humerus, the radial nerve दिया गया. Can you manage? Chalo, sir. Next one. The next concept, oh my god, how can you forget this one, sir? Anatomical snuff box. Every exam they are giving one question from here, sir. Okay. Now in this diagram, my dear friend, on the lateral side, there will be like two tendons, sir. The two tendons on the lateral side will be abductor pollicis longus, extensor pollicis brevis. On the medial side, there will be only one tendon, sir. And that one tendon on the medial side here will be the extensor pollicis longus. Extensor pollicis longus on the medial side, sir. That is the boundaries. And after that, what is the content of anatomical nerve box? ये तो सबको पता है. There is an artery here. That artery will be the radial arteries. Sir, ये सब ठीक है. Everything is fine. So we are done with the boundaries. We are done with the content. This is fine. But nowadays, the question is actually mainly coming from where, sir? It is coming from the floor of the anatomical snuff box, sir. So let me tell you in a crystal clear manner, the floor of the anatomical snuff box, sir. Here, ye batao, how many carpal bones do we have? 8 carpal bones. They will be scaphoid, and then lunate, then triquetrum, and then pisiform. Then trapezium, and then trapezoid, and then capitate, and then hamate. And then actually you'll be having the first metacarpal, and then the second metacarpal here, the third metacarpal here, the fourth metacarpal here, and the fifth metacarpal. Each and every digit will be having like 3 phalanges, except for the thumb, and thumb will have just 2 phalanges here, sir. This is the line diagram here of the bones in the hand. Then here in the forearm, we will be having 2 bones here. On the lateral side, there will be radius, and on the medial side, we'll be actually having a ulna here, sir. Just a schematic diagram, sir. Okay. यार अब आप मुझे ये बताइए, now tell me here, anatomical snuff box कहाँ है? The anatomical snuff box is actually on the lateral side here. ये वाला anatomical snuff box होता है ना on the lateral side. On the lateral side here. So therefore, what do you have in the floor of the anatomical snuff box, sir? The base of the first metacarpal, then the trapezium here, and the scaphoid here, and the styloid process of the radius. Wow, crystal clear concept. The base of the first metacarpal, trapezium, scaphoid, and the styloid process of the radius, that is all present in the floor of the anatomical snuff box. Previously, 1-2 years back, they used to ask about the boundaries, sir, but nowadays they are concerned about the floor. And in the recent July exam, there was a clinical question. A person falls on the outstretched arm. If the person falls on the outstretched arm here, then there is a pain in the anatomical snuff box. Already given in the question, there is a pain in the anatomical snuff box. And that pain is due to the fracture of which bone in the floor? तो फ्लोर में तो 4 बोन्स होते हैं, देयर लाइक 4 ऑफ देम, बट विच इज मोस्ट कॉमनली फ्रैक्चर्ड आउट ऑफ ऑल द कार्पल बोन? तो यू नो वेरी वेल, स्केफॉइड इज मोस्ट कॉमनली फ्रैक्चर्ड, और ये फ्रैक्चर हो जाता है जब बंदा गिर जाता है ऑन द आउटस्ट्रेच आर्म व्हेन द पर्सन फॉल्स डाउन. सो दैट विल लीड टू व्हाट सर? Yes, the pain in the anatomical nerve box. And which is the most commonly fractured bone there? That is your scaphoid. Perfect concept, sir. Crystal clear concept. Are you all done? The concept is like very clear here, sir. अगर आप लोग अगर इजाजत दो तो should I tell you like 2 more points, sir? A little bit in more depth. Should I tell you like 2 more points in a little bit more depth, sir? Recently in the exam they have given here okay, one muscle will be inserting on the shaft of the first metacarpal. Which muscle is inserting here? Arrow mark. Opponent's pollicis. Opponent's pollicis will be inserting here. But again, the same thing. What will happen after the exam? Recall question. Recall question में all the students are like having, confusion. कोई बोलेगा arrow mark यहाँ था shaft पर, और कोई बोलेगा arrow mark यहाँ था सर base पर. अगर base पर होगा यहाँ पर ना, if the arrow mark was at the base of the first metacarpal, there abductor pollicis longus will be inserted, sir. तो अगर shaft पर होगा, opponent's pollicis will be inserted, and on the base it will be abductor pollicis longus will be inserted, sir. Perfectly done. ठीक है ना? तो ये दोनों points अच्छे से याद रखिए, sir. All these are like many MCQs covered here, sir. So many concepts in the upper limb topic has been done here, sir. And by this, we are done with all the high yield concepts of upper limb. Let us go to the next topic right now. It is your lower limb, sir. So I hope all of you are understanding here, sir. Concepts are getting cleared. Hello, my dear friends. Are the concepts getting cleared? है ना? तो सारे topics हो गए sir upper limb में ना. Nerves related to humerus. We are done with abduction of the arm, muscles of hand, which nerves will be supplying, ulnar nerve, median nerve. Perfectly done, sir. Thank you. And now we are moving towards the lower limb topics, sir. चलिए आगे बढ़ते हैं lower limb topics. है ना? Are you all comfortable? Now in the lower limb topic, first look at this diagram here. मैंने आपको ये diagram इसीलिए दिया है क्योंकि there is a nerve which is actually coming from here, common peroneal nerve. And that common peroneal nerve will come here, and near the neck of the fibula, it will be dividing into superficial peroneal nerve and deep peroneal nerve. So this one is the common peroneal nerve. And exactly near the neck of the fibula, ये आपको याद रखना है sir. Location, neck of fibula, and that will be dividing into 2 branches. One will be the superficial peroneal nerve here. Another one will be the deep peroneal nerve, sir. And my student knows very well, superficial peroneal nerve will be supplied to which compartment of the leg? Lateral compartment. And in lateral compartment, there'll be like 2 muscles. One will be the peroneus longus. Another one will be the peroneus brevis. Deep peroneal nerve will be supplying to anterior compartment. In the anterior compartment of the leg, there is a muscle in front of tibia. Tibialis anterior. And in the anterior compartment, yaar, ye batana, you'll be having extensor muscles or flexor muscles, sir? Extensors or flexors? Thank you, Dr. Aryan. Extensor होते हैं कि flexor होते हैं? तो anterior compartment में extensor होते हैं. There will be extensor hallucis longus and there will be extensor digitorum longus. Extensor hallucis longus, extensor digitorum longus. Please be very careful here. Many students are telling anterior compartment will have flexor. Hello, Dr. Saab. Listen here. In upper limb, anterior compartment will be having flexor. Posterior compartment will be having extensor. And in the lower limb, anterior compartment will have extensor. Posterior will be having flexor. Sir. Don't get confused there. So anteriorly, they'll be having extensor. Sir. Now, peroneus longus and peroneus brevis, these 2 muscles are present in which compartment? Lateral compartment. And in the lateral compartment, they are actually helping in elevating the lateral border. That is helping in what, sir? Eversion of the foot. Eversion of foot पे help करेगा. और यहाँ तो मुझे पढ़ाने का जरूरत ही नहीं है सर. The name itself is telling you extension. Extension मतलब क्या होता है? They are actually helping in dorsiflexion of the foot, sir. Dorsiflexion of the foot. Are you understanding me? हाँ. So this is actually helping in dorsiflexion of foot, sir. और अगर ये nerve गया, if this nerve is gone, these muscles are gone, you will not be able to do the dorsiflexion of foot. The foot will be drop. Foot drop होता है sir. इसीलिए that is the reason why I want you to have a clarity in this concept here, sir. So common peroneal nerve is coming on the lateral side, exactly near the neck of the fibula. It divides into superficial peroneal nerve and deep peroneal nerve. Superficial peroneal nerve is supplying to the lateral compartment. In the lateral compartment, you're having two muscles, peroneus longus and peroneus brevis, and they will be helping in eversion of the foot. Anterior compartment, you'll be actually having the tibialis anterior, extensor hallucis longus, extensor digitorum longus, and they are going to help in dorsiflexion of the foot, sir. Dorsiflexion of the foot. Done. And then apart from that, apart from the muscles, let us learn the sensory supply right now. This is the first toe and the second toe here, and this is the cleft in the first toe and second toe. And this yellow color highlighted part, this one here, only this much skin will be supplied by deep peroneal nerve. So deep peroneal nerve will be supplying to the skin in the cleft of first toe and second toe. And the skin on the dorsum of the foot will be supplied by superficial peroneal nerve, sir. On the medial side of the leg and the foot, that will be supplied by saphenous nerve. And saphenous nerve, हम सबको पता है, it is a branch of your femoral nerve, sir. And the skin on the lateral side of the leg and the foot will be supplied by sural nerve. And sural nerve, mainly, it is actually the branch of tibial nerves. So by this, you will be able to manage with even the clinical questions also, sir. Suppose if they are telling you there is a loss of sensation on the dorsum of the foot, then tell me which nerve will be involved. Loss of sensation on the dorsum of the foot, which nerve will be involved? Superficial peroneal nerve. Loss of sensation in the skin in the cleft of first toe and second toe, which nerve will be involved? Deep peroneal nerve will be involved. Understanding? So in this manner, you can actually apply this concept in your clinical questions also. Next one. Now, what is the meaning of inversion of the foot and eversion of the foot? If you elevate the lateral border, अगर आप lateral border elevate करोगे, that is nothing but eversion of the foot. अगर आप medial border elevate करोगे, that is nothing but inversion of the foot. Eversion of the foot, अभी मैंने आपको बताया था, it is done by peroneus muscle, sir. There will be peroneus longus, and then you'll be having the peroneus brevis. Inversion will be done by the tibialis muscle. So there will be tibialis anterior, and then there will be tibialis posterior. So these two are helping in inversion, and those two will be actually helping in eversion of the foot, sir. Some students will remember like this also. Okay, inversion starts with I. So I and I. Eversion starts with E. So it is E and E, something like this here. So do something and remember, sir. जैसे भी आपको याद रहेगा, याद रखिए, लेकिन याद रखिए. Please remember this one here. Okay. So remember, inversion will be done by the tibialis muscles and eversion will be done by the peroneus muscles. Now, in the exam, they're also asking about the joint. The inversion and eversion will take place at which joint, sir? It will be taking place at subtalar joint, below the talus. Subtalar joint, sir. Done. Moving on to the next concept. This nerve here will be the genitofemoral nerve, sir. How to identify this nerve? Very easy. This muscle here will be the psoas major. और जैसे ही आप देखोगे एग्जाम में कि the nerve is piercing psoas major, अगर वो psoas major को pierce कर रही है, that is genitofemoral nerve, sir. Clearly, you're able to see this genitofemoral nerve here. I'm just writing GFN. Genitofemoral nerve here will be having like two branches here. One will be the genital branch. And this genital branch will be going to continue into the spermatic cord. आपको याद होगा, spermatic cord is going to pass through inguinal canal. And another branch here will be the femoral branch. So this is femoral branch of genitofemoral nerve. and that is going to supply to the skin over femoral triangle. ये recently exam में पूछा गया था. Skin over femoral triangle. Wow, everything done in a crystal clear manner, sir. और क्या चाहिए इस जिंदगी में, है ना? तो how to identify genitofemoral nerve, sir? It is the one which is going to pierce through the psoas major muscle. तो अगर आपने एग्जाम में इमेज देखा, इन दैट इमेज इफ द नर्व इज पियर्सिंग psoas major, दैट इज genitofemoral. और आपको क्लियरली नजर आ रहा है, दो ब्रांचेस होते हैं, genital branch and the femoral branch. Genital branch is the content of spermatic cord, whereas femoral branch is the one which will be supplying to skin over femoral triangle here, sir. Done. Crystal clear. Moving on to the next one. Okay. Now, the next one here, my dear friends, is attachment on femur. So, just now someone was actually, telling in the comment section, कि sir, lower limb वाले topics करना आज यहाँ पर. Welcome here, sir. We are going to do in detail. Attachments on femur are very, very much important, sir. But before that, let's see here. This one here will be the anterior superior iliac spine, and this one here will be anterior inferior iliac spine. Attaching to ASIS will be number one, there will be a ligament. That ligament will be inguinal ligament. And yes, of course, there is a very important muscle, sartorius muscle. And you will know the another name of this one really nicely. Taylor's muscle, also known as the honeymoon muscle, sir. Anterior inferior iliac spine, this will be attached with rectus femoris muscle, sir. Okay. Now in the femur, this trochanter here will be the greater trochanter. And greater trochanter will be attached with one muscle here anteriorly. And this muscle here will be the gluteus minimus muscle, sir. So gluteus minimus will be attached onto the greater trochanter and on the anterior aspects, anteriorly attached होता है. अगर हम इसको पीछे turn करेंगे, if you are going to turn this behind, again the same thing, this one here will be the greater trochanter. लेकिन याद रखिए, यहाँ पर जो muscle attach होगा, that will be the gluteus medius muscle, sir. It means gluteus medius and gluteus minimus are attached on greater trochanter, but anteriorly gluteus minimus and posteriorly will be having the gluteus medius. Now this one here will be the gluteal tuberosity. And which muscle will be inserted onto the gluteal tuberosity? That muscle will be your gluteus maximus muscle. So gluteus maximus muscle यहाँ पर insert होता है. Are you getting me here? Now, after learning about the attachments of this muscle, मैं आपको ना इसके actions यहीं पर पढ़ाता हूँ. I'll teach you the actions here itself. Now, gluteus maximus muscle, it is the one which is helping in extension at hip joints. Extension at the hip joint. Now, I hope you are sitting there and I'm also sitting here. In the sitting position, our hip joint will be actually flexed. Now, from the sitting position, if you are actually going to stand up, that is helping in extension. And not only extension, it will be also helping in external rotation also. Gluteus medius, it will be actually helping in abduction at the hip joint. Along with abduction, it is also helping in internal rotations. Even minimus, also the same thing. Gluteus minimus is also helping in abduction at the hip joint. Along with abduction, internal rotations. तो बड़ा आसान हो गया, easy, done. Attachment भी हो गया और action भी हो गया, sir. चलिए आगे बढ़ते हैं, sir. Let's go ahead. Now, in this diagram, जो सवाल आपके MC exam में पूछा गया था, this is lesser trochanter. And which muscle will be inserted onto the lesser trochanter? Lesser trochanter पर कौन सा वाला muscle attach होता है? Number one, iliacus muscle. Another one will be the psoas major muscle, sir. So iliacus and psoas major muscle will be inserted onto the lesser trochanter. And some authors love to call it as ilio-psoas together, sir. Ilio-psoas कहा जाता है. Iliacus and the psoas major. Done? Now, and nowadays something very much trending, sir. This spine here will be known as the ischial spine. Oh my God. Now, in your MCA exam, many times they are asking the question here, sir. Ischial spine के बारे में, क्योंकि यहाँ से ना एक nerve ऐसे turn होता है. There is a nerve which is going to turn here, and that nerve is very famous one, pudendal nerve, sir. Pudendal nerve turns around the ischial spine. Not only pudendal nerve, along with that, internal pudendal artery and vein, internal pudendal vessels. Along with that, even nerve to a muscle, and the name of the muscle is obturator internus. So nerve to obturator internus is also taking a turn there. And students love to remember this one with the mnemonic as pin. The pin structures are turning around the ischial spine. So pudendal nerve, internal pudendal artery and vein, and the nerve to obturator internus. So all these are going to take a turn around the ischial spine. So number one question which is asked in your MC exam is which nerve is going to turn around the ischial spine? Pudendal nerve. And that is the actually site for pudendal nerve block. So what is the site for pudendal nerve block, sir? Ischial spine is the site for the pudendal nerve block. ये भी सवाल आपके एग्जाम में पूछा गया था. Are you understanding me? So in this manner, just in two diagrams, like a lot of things has been completed. No need to learn here and there randomly and confuse yourself, sir. बस ये दो diagram और खलास. Are you समझ में आपको? Are you understanding me, sir? So many things are done here, sir. Let us go ahead with the next concept right now. The moment you see that there is a nerve coming from the inner aspect of the ilium, ये ilium के अंदर से ऐसे आ रही है ना nerve, and this nerve is nothing but the lateral cutaneous nerve of the thigh. Of course, from the name itself, we can understand lateral cutaneous nerve of the thigh will be supplied to the skin on the lateral side of the thigh. And the skin on the lateral side of the thigh is supplied by lateral cutaneous nerve. But what is going to happen in the obese people? The abdomen will be like protruded like this here. इसीलिए this nerve will be actually getting compressed here, sir. Near the inguinal ligament, ये compress हो जाता है. The patient will come to you with the pain and burning sensation on the lateral side of the thigh, and that condition is known as meralgia paresthetica. So which nerve is involved in meralgia paresthetica? Lateral cutaneous nerve of the thigh will be involved here, sir. In July, this question has been asked, sir. Already आपके ना एग्जाम में पूछा गया. ओके, चलिए आगे बढ़ते हैं सर. ऑलरेडी ये वाला डायग्राम तो हमने डिटेल में डिस्कस कर लिया है ना. हाँ, टार्सल टनल. तो दिस टनल दैट यू आर एबल टू सी हियर, दिस टनल विल बी द टार्सल टनल सर. यहां पर आपको याद रखने के लिए इंपॉर्टेंट ये है, प्लीज रिमेंबर दिस नर्व हियर सर. Which nerve is taking a turn here? This is your tibial nerve. And then there is an artery here. This artery will be the posterior tibial artery. Now, in this tarsal tunnel, sometimes what will happen, the tibial nerve will be compressed. इसीलिए उसको कहा जाता है tarsal tunnel syndrome. So what is a nerve which will be involved in the tarsal tunnel syndrome, sir? Tibial nerve will be involved. ठीक है ना? Then what is the artery present over here? Posterior tibial artery. और अगर आप यहाँ पर इस डायग्राम को देखोगे, if you just keep your fingers over there, you will be able to, yes, feel the peripheral pulse over there. So which artery, by which artery you are able to feel the peripheral pulse? That is a posterior tibial artery. And that was an image-based question in your MC exams. So that is important to remember here. Now moving on to the next concept here, the femoral triangle. Femoral triangle किसके बीच में form होता है? This ligament that you are able to see here is inguinal ligament. Okay, that is going to form the base. And then this muscle here will be the sartorius muscle, sir. That is going to form the lateral boundary. And this one here will be the adductor longus. And adductor longus is going to form the medial boundary, sir. So between these three, the femoral triangle is formed. But I am interested about the floor of that one. आपके एग्जाम में ना floor पूछा गया था. The floor is formed by iliacus muscle, and this one here will be the psoas major muscle, and this one here is pectineus muscle, and then this one is adductor longus muscle. Sir. Understanding? So how many muscles are going to form the floor of the femoral triangle? There are four muscles forming the floor, sir. Iliacus, psoas major, pectineus muscle, and adductor longus. ये आपके एग्जाम में पूछा गया था. This was asked in your MCI exam, sir. Are you understanding me here? Perfectly done, sir. Now, welcome to the most important thing, that is the gluteal region, sir. Now, in the gluteal region, first of all these muscles are covered by gluteus maximus. लेकिन हमने ना यहाँ से gluteus maximus निकाल दिया है. We have removed the gluteus maximus. Remember, gluteus maximus will be supplied by inferior gluteal nerve, sir. And in this diagram, you are able to see this is gluteus medius, and this one here will be the gluteus minimus. And these two muscles are supplied by superior gluteal nerve, sir. Sometimes what will happen, the superior gluteal nerve will be injured. Injury of this one will lead to lurching gait. The person will be actually bending the body on one side and walking, lurching gait, sir. And in the lurching gait, The sign which is positive here will be the Trendelenburg sign. Trendelenburg sign will be positive here in the lurching gait, sir. So which nerve will be involved? Superior gluteal nerve. And which muscles will be involved here, sir? The gluteus medius and the minimus will be involved. Done, 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 sir. Now in this diagram, this one here will be the greater sciatic foramen. And from the greater sciatic foramen, you're able to see piriformis muscle coming out here, sir. And not only this, you are able to see this small muscle here. This one will be gemellus superior. Now, why this is gemellus superior? Why? Because one more small muscle here. This is gemellus inferior, sir. And then this muscle is obturator internus. And this rectangle shaped muscle is quadratus femoris, sir. Okay. And remember, gemellus superior and obturator internus, these two are supplied by nerve to obturator internus. Very easy. Gemellus inferior and quadratus femoris will be supplied by nerve to quadratus femoris, sir. Kya baat hai. Perfectly done, sir. So why I'm telling you all these things in the diagram itself here, sir? Because this image was given in your MC exam, sir. So not only just learning the names of the muscles, you should be also learning the diagram also. You should be able to identify the diagram also. Understanding? So gluteus maximus will be supplied by inferior gluteal nerve. Gluteus medius and minimus will be supplied by superior gluteal nerve. अगर वो injure हो जाएगा, lurching gait होगा, Trendelenburg sign will be positive in that one. And what is the muscle coming out from the greater sciatic foramen? That is piriformis muscle. Remember that one. Then after that, you'll be having four muscles: gemellus superior, obturator internus, gemellus inferior, quadratus femoris. Done, done, done. And by this, all the muscles and nerves supplying the gluteal region is done, sir. Okay. Next concept, iliotibial tract. Now, in this diagram, you are able to see this complete band here, sir. And this band is known as the iliotibial tract. Okay. Now, this iliotibial tract, why it is important for your MCI exam? You can clearly see the one muscle which is inserting here. Gluteus maximus muscle is inserting here. And this muscle which is inserting here will be tensor fasciae latae. So gluteus maximus and tensor fasciae latae, two muscles are inserting onto the iliotibial tract. इसीलिए ये वाला important है. Okay. Next one here, tarsal bones. How can we forget this one here, sir? In your MC exam, they're asking this many times here, my dear friends. Yes. This bone here, the big heel bone here will be calcaneus. Above the calcaneus, this one is talus. In front of the talus, this one is navicular. अच्छे से identify कीजिए sir, navicular. And then this one here will be cuboid. And then you'll be having the three cuneiform. So these three are the cuneiform. And then number 4, cuboid. Number 5, navicular. Number 6, talus. And number 7 will be the calcaneus. All this will be the 7 tarsal bones, sir. Yes. Recently in the exam, they have asked, कि talus ossification कब होता है? So remember, talus will be ossified 6th or 7th month of the intrauterine life, sir. And on the talus, there will be no muscle attached. Remember that one? There is no muscle attached on the talus. And then, what is the joint between the talus and the navicular and the calcaneus? This joint. That is talo-calcaneo-navicular joint. And remember, that is an example of ball and socket joint. And between the calcaneum and the cuboid, this joint here will be the saddle joint, sir. So I repeat again, talo-calcaneo-navicular joint will be the ball and socket joint. And calcaneo-cuboid joint will be an example of saddle joint, sir. So these many points you have to remember. And not only points, remember, you should be able to identify these bones also, guys. I hope you'll be able to do that one. Is it okay? Fine here. And by this, we have completed like almost all the concepts here in the lower limb topic, which are very much important for your exam, sir. ठीक है ना? अब चलिए आगे बढ़ते हैं सर with the next topic, that is your embryology topic, sir. Embryology start करते हैं, ठीक है ना? Acha, Chaudhary ji, you are asking about the knee bursa, which was asked in the this one. No? Actually, bursa and knee joint and everything, it is done in your. It might be done in the orthopedics, right? Orthopedics में हुआ होगा? नहीं हुआ? तो पटेला जो होता है ना, पटेला के नीचे इंफ्रा पटेलर बर्सा, इंफ्रा पटेलर बर्सा, अगर वो अगर अगर उसमें ना इन्फ्लेमेशन होगा, दैट इज नथिंग बट बर्साइटिस. तो कैन यू प्लीज टेल मी, इंफ्रा पटेलर बर्साइटिस विल बी नोन एज, व्हाट इज द कॉमन नेम फॉर दैट वन? बिफोर गोइंग टू एम्ब्रियोलॉजी, हाँ, क्लर्जी मैंस नी कहते हैं. वेरी गुड योगेश. बाय द वे, हेलो जी, एक्चुअली ना क्लर्जी मैन, आप बाद में ना गूगल करके देख लेना, इट्स नॉट लाइक ए मेडिकल टर्मिनोलॉजी सर. क्लर्जी मैन इज अ पर्सन हु इज नीलिंग डाउन एंड प्रेइंग इन द चर्च सर. तो ना चर्च, आप कभी चर्च गए हो? हैव यू एवर बीन टू चर्च? लाइक आई हैव बीन टू लाइक मेनी मेनी चर्च सर, मैं कई बार गया हूँ. तो क्लर्जी मैन में क्या होता है? द क्लर्जी मैन इज दैट पर्सन विच विल बी नीलिंग डाउन. वो नील डाउन करके ना चर्च में प्रे करता है. तो ऐसे याद रखो, डोंट ट्राई टू मग अप. अगर बंदा नील डाउन कर रहा है तो देर फोर मान लो कि ये थाई है और ये लग है और यहाँ पर पटेला है, तो कौन सा वाला बरसा, विच बरसा विल अंडरगो इन्फ्लेमेशन, विच इज प्रेजेंट बिलो? इंफ्रा पटेलर बर्साइटिस, क्लर्जी मैन स्विमिंग. Learn according to my concepts. Infrapatellar bursitis will be clergyman's knee. Okay. अब housemaid's knee. Housemaid का क्या होता है? The problem with the housemaid is that कि she is also like kneeling down. She और he जो भी होगा, हाउसमेट जो हमारे घर पे काम करने वाले लोग होते हैं ना, तो वो लोग भी नील डाउन करके ना ऐसे मॉपिंग वगैरह करते हैं. लेकिन दे आर नॉट गोइंग टू नील डाउन स्ट्रेट ना, तो वो थोड़ा सा बेंट होते हैं आगे, क्योंकि उनको मॉपिंग वगैरह साफ सफाई करनी होती है. तो व्हेन दे आर बेंडिंग अ लिटिल बिट फॉरवर्ड हियर, मान लो ये पटेला है, तो विच बर्सा विल अंडरगो इन्फ्लेमेशन, दैट इज प्री पटेला. ऐसे याद रखने का तरीका होता है. Understanding here? So clergyman is kneeling down straight like this here. Infrapatellar bursitis. So infrapatellar bursitis, clergyman's knee. Prepatellar bursitis, housemaid's knee. क्योंकि housemaid थोड़ा सा आगे बेंड होती है. खत्म, डन. इतना आसान है याद करना, समझ में आ रहा है? तो फालतू में ना रट्टा मत मारो सर. प्लीज डोंट डू रट्टा एंड ऑल. ऑल दैट वन लाइनर चैंटिंग इज नॉट गोइंग टू हेल्प यू. लर्न विद द कॉन्सेप्ट सर, कॉन्सेप्चुअली पढ़िए. तो क्लर्जीमैन किसको कहते हैं, वहां से पढ़िए. बच्चे खाली बस रट्टा वहां क्लर्जीमैन क्लर्जीमैन क्लर्जीमैन, इंफ्रा इंफ्रा इंफ्रा, ऐसे नहीं होता है, ऐसे नहीं होती पढ़ाई. लर्न विद द कॉन्सेप्ट. तो क्लर्जीमैन नी, द पर्सन हु इज एक्चुअली गोइंग टू नील डाउन इन द चर्च एंड प्रेइंग इन द चर्च, है ना? तो आपने तो वो डीडीएलजे मूवी देखा होगा, वो जाके ऐसे ना ऐसे हाथ रख के वहां पे प्रे करते हैं, नील डाउन करते, है ना? फिर शाहरुख खान आता है, फिर बोलता है कि इसने जो मांगा है वो पूरी कर देना. हाय हाय, क्या रोमांटिक बात है. आगे बढ़ते हैं सर, एम्ब्रियोलॉजी. हाँ, थैंक यू थैंक यू. थैंक यू डॉक्टर. प्लीज फाइंड अ वे टू टीच ऑल द सब्जेक्ट. इसी में मेरी लगी पड़ी है एनाट बायोकेम में. इसी में टाइम नहीं मिल रहा है एंड यू आर लाइक प्लीज टीच ऑल ऑफ दम. चलिए सर, आगे बढ़ते हैं. नाउ एम्ब्रियोलॉजी सर, शैल वी बिगिन? शैल वी बिगिन? डॉक्टर हेनरी ज्वाइनिंग फ्रॉम Zambia. Wow. Thank you. It's my pleasure. It's my pleasure to teach you people. Actually, recently I got like many messages from there also, like Sudan and Africa. So चलो सर, आगे बढ़ेंगे सर. Shall we go ahead now? हाँ, perfectly fine. Everything is going good. I was just checking before moving ahead with the next topic, sir. So now the next topic that we are going to start with the embryology topics right now. Now in embryology topic, first of all, look at this diagram here, sir. Okay, now. Thank you, G. Now, yes. Now in this diagram here, my dear friend, this is actually the transverse section of the embryo here, sir. Thank you. The students are joining from Zambia there. Okay, don't, no problem, Dr. Ashman. Biochemistry भी हो जाएगा. We'll be doing this one here. Don't worry about that. ठीक है ना? Okay. जी. Hmm. Now, in this diagram, first of all, you are able to see this one here will be the ectoderm here, sir. Now, my dear friends, everyone, please concentrate here. Actually, embryology is a very important one. And once we are done with the embryology, it will take a little bit of time, sir. All the important concepts in embryology. Once they are done, the embryology wala concepts here, sir. After that, it will be done very quickly because we are just left out with the thorax and abdomen part, sir. वो तो फटाफट हो जाएगा. Okay, no? It will be done in like 15-20 minutes, sir. So 15-20 minutes for this one and that one. So hardly another like 40-45 minutes, everything will be done, sir. So just be with me. ठीक है ना? Is it okay? Okay, fine here, comfortable ना? हम लोग ब्रेक वगैरह नहीं लेते यार. ब्रेक लेंगे तो ना फिर वो रिदम खत्म हो जाएगा एंड ऑल विल बी डिस्टर्ब्ड एंड ऑल दोस थिंग्स. लेट अस नॉट वेस्ट अवर टाइम इन द ब्रेक एंड ऑल. लेट्स कंटिन्यू हियर, ठीक है ना? Now this one here will be ectoderm and this one here will be the endoderm, and in the middle you'll be actually having the mesoderm here, sir. 3 germ layers. Of course, this is in the third week, sir. Now this one here will be the notochord. And above the notochord, this one here will be the neural tube here, sir. And just adjacent to the neural tube on either side, you'll be having neural crest cells. Which cells do you have, sir? Neural crest cells here, sir. So first, you should be able to identify this diagram here, sir. ठीक है ना? अब सुनो ध्यान से. पहले हम डिस्कस करेंगे. We are going to discuss like one by one about everything here, sir. So first, let us discuss about the neural tube here, sir. Now, this is how the actual neural tube looks like here, sir. And remember, neural tube is the one which is going to form your central nervous system. And central nervous system will be including your brain and the spinal cord here, sir. In this neural tube, you'll be having anterior neuropore, which is also known as the cranial neuropore, which is also known as the rostral neuropore. And then there is a one more opening below here, that is a posterior neuropore, which is also known as caudal neuropore, sir. Normally, the anterior neuropore should be closed on 25th day, whereas the caudal neuropore will be closed on 27th or 28th day, sir. अगर मान लो कि anterior neuropore close नहीं होगा, if it doesn't close, this condition is known as anencephaly. If the caudal neuropore does not close, then this condition here is known as the spina bifida. Spina bifida or spina bifida, whatever it is, spina bifida. ठीक है ना? So if actually the cranial neuropore does not close, it is known as anencephaly, and if the caudal neuropore does not close, that is spina bifida. So in recent exam, they have given this condition here, where you are able to see anencephaly here, and along with the anencephaly, there is a bony defect of spine also. Bony defect of the spine also, sir. है ना? So this spines here, there is a defect in this one. That is continuous with this one here, sir. So anencephaly bhi hoga, there is a bony defect of the spine, and this condition is known as rachis, the cranial rachis, or craniorachis, whatever. ठीक है ना? So this condition is known as craniorachis. It is anencephaly along with the bony defect of the spine, sir. Okay, now. Thank you. Welcome, Anastasia. If I'm telling your name correctly. So neural tube formation ho gaya. We are done with the cranial neuropore. We are done with the caudal neuropore. We are done with the defects there, sir. So that is about the neural tube done here. Perfect. And now neural crest cells derivatives are very much important for your MCI exams. Number one, remember all the ganglions will be derived from the neural crest cells. Number one. Number two, adrenal medulla. I hope all of you know that adrenal gland will be having two parts. The outer part will be cortex, inner part will be medulla. Adrenal medulla will be derived from neural crest cells. Parafollicular cells are also derived from neural crest cells. Parafollicular cells, they're also known as what, sir? C cells. Apart from that, yes, melanocytes, sir. Melanin forming cells, melanocytes are also derived from neural crest cells. And along with that, remember conotruncal septum. So even conotruncal septum is also derived from neural crest cells. And conotruncal septum is the one which is actually going to form, which is actually the combination of two septums, sir. One is your spiral septum, another one is the bulbar septum. Okay. So all the ganglions, adrenal medulla, parafollicular cells, melanocytes, conotruncal septum, all of them will be derived from the neural crest cells. Is it okay? Done here. Then apart from that, my dear friends, learn about the mesoderm here right now, sir. The mesoderm will be actually divided to how many parts here? 3 parts. Now, this mesoderm here will be known as the paraxial mesoderm, sir. Ye wala. Paraxial mesoderm. And this paraxial mesoderm is the one which is actually going to form somites. Remember that word. That is important for your exam, sir. Somites form content. This one will be the intermediate mesoderm, which is going to form urogenital system. And this one here will be the lateral plate mesoderms. Fine here. So the mesoderm in the middle here will be divided into 3 parts here. Paraxial mesoderm, intermediate mesoderm, and the lateral plate mesoderms. Okay, G, done here. Now, after that, my dear friends, let us go ahead with the next topic right now. Ectodermal cleft and endodermal pouches, sir. So ectoderm is going to form the cleft. There will be like totally 4 clefts, sir. And remember, the first cleft ectoderm is going to form what? That is going to form the external acoustic meatus. Along with external acoustic meatus, it is also going to form the outer layer of tympanic membrane. But you can see very clearly in my diagram here, sir, the second cleft and the third cleft and the fourth cleft is completely closed, nothing forming from here, sir. यहाँ से कुछ भी form नहीं होगा. And why it is happening like this? Why? Because you can clearly see here, the second arch is overlapping that one. It is growing faster and closer. So therefore, thank God, we just have to learn from the first cleft here, sir. So the first cleft is the one which is going to form your external acoustic meatus. The second, third, and the fourth cleft will be completely obliterated. They're closed. Okay. Now, what about the endodermal pouches, sir? The first pouch here, it is going to form your middle ear cavity. Along with the middle ear cavity, it is going to form the eustachian tube. And along with the eustachian tube, it is also going to form the inner layer of tympanic membrane. The second pouch here, it is the one which is going to form palatine tonsils. But remember, not the entire palatine tonsil, it is going to form epithelium of the palatine tonsil. So middle ear ho gaya, thoda sa niche palatine tonsil, epithelium of the palatine tonsil. The third pouch is very much important here for your MCI exam. It is going to form thymus. And how to remember? Remember, third pouch is going to form thymus. Third pouch is going to form thymus. Okay. And along with the thymus, it is going to form inferior parathyroid gland. And the fourth pouch is the one which is going to form your superior parathyroid gland. Okay, now, that is about the ectodermal cleft, endodermal pouches. It is done in one diagram. Sir, ek diagram mein ye ho gaya. Now, welcome to one important clinical condition here. The third and the fourth pouch will be involved in DiGeorge syndrome, sir. I think you people have learned about this one in pediatrics. In pediatrics, you people have learned about the DiGeorge syndrome there. Which pouches will be involved in that? The third and the fourth pouch will be involved in that one, sir. Take it. Next one, arch arteries. Definite question in your January exam, sir. Pakka yahan se ek sawal aayega. First, try to understand this diagram here. In this diagram, this one here will be the right dorsal aorta, and then there will be the left dorsal aorta, sir. Right dorsal aorta, and then there will be left dorsal aorta. There will be 2 dorsal aortae during development. And this one here will be aortic sac. Aortic sac is present ventrally. Ye aage hota hai. And connecting them, these arteries are known as the arch arteries, obviously, which are going to pass through your pharyngeal arches here. Okay, na? So, aage hota hai. Try to understand the diagram first of all. In the front, you will be actually having the aortic sac, and behind you'll be actually having the right and left dorsal aorta. And then in the middle, they will be connected by the 6 arch arteries over there. Now, the fourth arch artery is the one which is going to form arch of aorta. So please remember, arch of aorta is derived from where? Left fourth arch artery. The third arch artery is the one which is going to form your carotid artery here, sir. Common carotid, internal carotid, external carotid, whatever it is, all your carotid arteries are derived from all the carotid arteries are derived from third arch artery. And then the sixth arch artery is the one which is going to form your pulmonary artery, sir. Pulmonary artery. So therefore, remember, my dear friends, the pulmonary artery here, pulmonary artery will be derived from the sixth arch artery. And finally, there is a ductus arteriosus between the pulmonary artery here and arch of aorta. This is known as the ductus arteriosus. And again, the same thing, it is derived from left sixth arch artery, sir. Okay, now, like this is the simplest way to remember this one here. You have to actually remember the numbers here, sir. Are you understanding my point here? Yes, you people actually have to remember the numbers here, sir. This is one of the simplest way to remember this one. So arch of aorta is derived from left fourth arch artery. And then carotid arteries are derived from the third arch artery, sir. Carotid artery is derived from third arch artery. And then pulmonary artery will be derived from the sixth arch artery on both the side. And ductus arteriosus will be derived from the left sixth arch artery only, sir. इससे ज़्यादा simple नहीं हो सकता है. It can't be much more simple than this one here. And my dear friends, do you all remember the recurrent laryngeal nerve? Recurrent laryngeal nerve आपको याद होगा ना? है ना? So there will be a right recurrent laryngeal nerve and the left one here. The right one is going to take a turn around subclavian artery, and the left one is going to take a turn around arch of aorta. That is the reason why the left recurrent laryngeal nerve is more longer here. It's more longer here, whereas the right recurrent laryngeal nerve यहीं पर आ जाता है. क्यों? क्योंकि this part here will be nothing forming there. This part here, nothing is forming here. तो right वाला थोड़ा ऊपर आ जाता है, sir. तो right, I repeat again, sir. The right recurrent laryngeal nerve is shorter course and the left recurrent laryngeal nerve is having a longer course यहाँ पर. क्योंकि वहां पर क्या होता है, there is a formation of ductus arteriosus. After birth, it is the one which is going to become your ligament, ligamentum arteriosum. And that is the reason why that left side, it is going to take a turn around the arch of aorta. That is having more longer course. But whereas right side, this part will be actually degenerated here. तो वो थोड़ा nerve ऊपर आ जाता है, turning around the subclavian artery. Crystal clear concept here, sir. So which recurrent laryngeal nerve will be having a longer course? Left one. Left recurrent laryngeal nerve will be having a longer course, sir, because of this reason only. Are you understanding in the embryology? चलिए सर आगे बढ़ते हैं. Let's go ahead now. This diagram is actually representing you the congenital diaphragmatic hernia. Now, congenital diaphragmatic hernia will be due to a defect in the development of diaphragm. But which part of the diaphragm, sir? That is pleuroperitoneal membrane. So congenital diaphragmatic hernia will be occurring due to the absence of pleuroperitoneal membrane, sir. It's very simple. Diaphragm यहाँ पर form हो रहा है, ऊपर प्लूरा होता है और नीचे पेरिटोनियम होता है. तो pleuroperitoneal membrane अगर ये absent होगा, then the pressure in the abdomen will be more, and the abdominal contents, they're actually going to enter into the thorax. Pressure यहाँ ज़्यादा होता है, the coils of intestines are entering into the thorax, compressing the lung, that is leading to lung hypoplasia and also. Whatever it is, I want you to remember that one word there, congenital diaphragmatic hernia will be due to absence of which membrane here, sir? Pleuroperitoneal membrane will be absent. Okay, are you understanding here, Dr. Amit? Thank you. Yes. Now welcome to the another very, very important thing, sir. Development of the face. Definite question from here about the cleft lip, sir. ठीक है ना? Are you understanding here, sir? Now, our face is actually developing from only two sources. This one here will be the mandibular process. Okay. And this one here will be the frontonasal process. अगर आप ध्यान से देखोगे, this much face here, it will be formed from the mandibular process here. अगर ये mandibular process हो गया है, तो बचा क्या? What is remaining right now? The frontal and nasal, frontonasal process. ये दोनों मिलकर face form होता है. Wow. So face is formed from mandibular process and the frontonasal process. Simple. Now this mandibular process itself is actually giving rise to the maxillary process here, sir. Mandibular itself is giving rise to the maxillary process here. So this one here will be the mandibular process. And this one here will be the maxillary process. थोड़ा ना नाम आराम से लिखते हैं सर, क्योंकि once you write down the names here very clearly, after that it becomes very easy. Now this one here will be the frontonasal process. And that frontonasal process will be having nasal pit, nasal pit. And this nasal pit on either side, it will be having the medial nasal process here, medial nasal process here. And this one here will be the lateral nasal process here. And this is the lateral nasal process. So let me write down the name here right now, my dear friends. This one will be the medial nasal process. This one here will be the lateral nasal process. Did you all understand the terminology? Come on, sir. Did you all understand the terminology here? अगर आपको ये समझ में आ गया terminology, now this becomes damn easy here. So this concept is like very much easier right now. Mandibular process and mandibular process will fuse together to form the lower lip, sir. और अगर मान लो कि यहाँ पर mandibular process fuse नहीं होगा, yes, my dear friends, if the mandibular process does not fuse here, then what is going to happen? That will lead to midline cleft lower lip. Midline cleft lower lip. It's due to non-fusion of mandibular process. Wow, easy. Upper lip कैसे form होता है? In the upper lip, actually in the middle, there is a depression here. That depression will be philtrum. What does that mean, sir? Philtrum कहते हैं उसको. And that is formed by the medial nasal process and medial nasal process. अगर ये medial nasal process fuse नहीं होगा, midline cleft upper lip, midline cleft upper lip, it is due to non-fusion of medial nasal process. Unilateral cleft upper lip, sir, on the lateral side will be having, on this side, unilateral. It is due to non-fusion of maxillary process with the medial nasal process. ये दोनों fuse नहीं होते हैं. तो अगर ये दोनों fuse नहीं होंगे, तो it will lead to unilateral. और अगर दोनों साइड भी फ्यूज नहीं होगा, नॉट फ्यूज्ड हियर, नॉट फ्यूज्ड हियर, देन इट विल लीड टू बाइलेटरल क्लेफ्ट अपर लिप, सर. बाइलेटरल क्लेफ्ट अपर लिप, बाइलेटरल क्लेफ्ट अपर लिप, सर. इजी सर, है ना? समझ में आ रही बात आपको? चलिए एक बार ना हम लोग दोबारा रिपीट करते हैं इसको. लेट अस रिपीट वंस मोर हियर. नॉन फ्यूजन ऑफ मैंडिबुलर प्रोसेस. और आप लोग आंसर करते जाइए सर. यू पीपल कीप ऑन आंसरिंग मी राइट नाउ. आई वांट टू चेक यू पीपल हियर. और अभी याद हो जाएगा सर. इन दिस सेशन ओनली यू कैन लर्न दिस वन वेरी इजीली गाइस. आफ्टरवर्ड्स यू कैन नॉट मग अप. Non-fusion of mandibular process. Non-fusion of mandibular process. Come on. Midline cleft lower lip. है ना? Non-fusion of medial nasal process. Medial nasal process अगर fuse नहीं होगा. Midline cleft upper lip, sir. Non-fusion of maxillary with the medial nasal. Maxillary with medial nasal. Maxillary with medial nasal अगर fuse नहीं होगा. Unilateral. और अगर वो दोनों साइड में भी फ्यूज नहीं होगा, then it is bilateral. अब आप मुझे बताइए, is it like that difficult to remember this one? क्या ये difficult है याद रखने के लिए? Not at all. Understanding here? And by this, we are done with all the important concepts in the embryology that you have to know for your MC exams. You know, arterial system is done, pharyngeal clefts and the pharyngeal pouches, development of diaphragm, you know, the development of the face, and then we are done with the embryo, all the mesoderm, neural tube, notochord, सब कुछ हो गया है सर. ठीक है ना? Are you understanding me here? That's how. These are all the points you have to remember for your embryology part, sir. ठीक है ना? चलिए इसके बाद में we have to actually go towards the easy part right now, sir. The thorax and abdomen will do, sir. ठीक है ना? No need to रट्टा. हाँ, रट्टा मारने का तो जरूरत ही नहीं, sir. Okay. Just give me 1 minute, sir. I'll get some water for me and we'll begin. And please don't go anywhere here. I'm just going to get water for me here. Okay ना? पानी लेकर आऊंगा मैं. कहीं पर मत जाइए सर. Thorax and abdomen फटाफट हो जाएगा. In another like no, it is 10:05 ना. By 10:30 I'll leave you, sir. 10:30 हम लोग निकल जाएंगे. ठीक है ना? One word to you, sir. God bless you. Thank you, dear. Thank you, dear. वही तो चाहिए बस. ठीक है ना? दुआ करिए सर मेरे लिए. यस डॉक्टर शुभम वर्मा, वेरी नाइस वेरी नाइस। चलिए सर आगे बढ़ते हैं। थैंक यू सर। एम्ब्रियोलॉजी भी आपका हो गया इजीली। नाउ वेलकम टू द thorax टॉपिक राइट नाउ सर। इन thorax टॉपिक ना, द मोस्ट इंपॉर्टेंट थिंग फॉर योर एफएमजी एग्जाम इज दैट के they'll be asking about the positioning of the heart, sir. So in this diagram, you're actually able to see here, this is the apex of the heart, sir. And now, first of all, try to understand here, this is superior vena cava here, and this one is the inferior vena cava here. Both of them will open into the right atrium. This one will be the right ventricle. Behind the right ventricle, there will be left ventricle here, sir. And now, this one here will be the apex of the heart that is formed by left ventricle. Now, here you'll be actually having the base of the heart, and base of the heart is formed by both right atrium in the front and left atrium behind, sir. If both of them are given the option, remember, right atrium is going to contribute 1/3, left atrium is going to contribute the 2/3. So please remember that left atrium is going to be the answer agar dono bhi option diya jayega. Okay. Then after that, apex important hai, base important hai, sir. That is the only thing important. They will never ask you about the inferior and lateral surface. Leave it. Now, in one of the exam, what they have done is they have given this chest X-ray and what is going to form the right cardiac shadow. So right cardiac shadow here, it is formed by SIR, superior vena cava, inferior vena cava, as well as the right atrium, sir. I can show you that in this diagram also, sir. The right cardiac shadow will be actually formed by all the three of them, sir. Superior vena cava, inferior vena cava, and the right atrium. Superior vena cava, inferior vena cava, and the right atrium, that is going to form the right cardiac shadow. Recently in your exam, they have given this section, sir. ऐसा section दिया गया था, and you have to identify the chambers. अरे यार इतना आसान है. It is so easy here. In this diagram, this one here will be the right atrium. आगे होता है ना ventrally. उसके पीछे क्या होता है सर? Left atrium. And this one here will be the right ventricle, and this big chamber here will be the left ventricle. Easy to identify. है ना? Vertebrae होंगे तो this is the dorsal side, and this will be the ventral side. तो आगे कौन सा वाला होता है? Ventrally कौन सा वाला chamber होता है? The right atrium and the right ventricle. I hope you will be able to identify here, sir. So basically in this rapid revision program here, what I'm trying to teach you here is that they're asking many questions regarding the positioning of the heart, sir. Apex, base, and all those things in different ways. You should be able to identify them. Okay, now next one, root of the lung. I hope all of you know at this moment, अब तो आपको पता ही होगा कि this one will be the root of the right lung here, sir, and this one here will be the root of the left lung. And in the root of the right lung and the left lung, you have to remember how are the structures arranged. Above downwards and anterior posteriorly, sir. ऊपर से नीचे और आगे से पीछे. Okay. और ये इतना आसान है, याद रखना. मैं आपको बताता हूँ. You can answer the question in less than 1 minute here. ऊपर से नीचे याद रखिए. सबसे पहले क्या होगा? आर्टरी होगा, फिर ब्रोंकस होगा, फिर वेन होगा, सर. If you don't trust me, look at the left lung here, sir. So you are able to see the pulmonary artery here. फिर उसके नीचे ये वाला ब्रोंकस नजर आ रहा है, and then you'll be having the two pulmonary veins, artery, bronchus, and vein. So remember this one with the mnemonic, like Atal Bihari Vajpayee, our respected ex-prime minister. तो ऊपर से नीचे it is ABV, above downwards it is ABV, अटल बिहारी वाजपेयी. ठीक है ना? और एंटीरो पोस्टीरियरली कैसे अरेंज होता है? इसी को उल्टा कर दीजिए. That is VAB, sir. खत्म. That is anterior to posterior. कहानी खत्म, sir. That's all. Topic done in 2 minutes here. So if this question will come in the exam about the arrangement of structures in the root of the lung, ABV, VAB. ऊपर से नीचे ABV और आगे से पीछे VAB, sir. खत्म कहानी. और यहाँ से सवाल क्या आता है? What is the question that they'll be asking in the exam? The question will be like, which is the cranial most structure in the root of the left lung? Which is the cranial most structure in the root of the left lung? Which is the lowermost structure, uppermost structure? Something like that question will be coming, sir. You'll be easily able to manage this one here. है ना? चलिए आगे बढ़ते हैं, sir. Thoracic duct. About the thoracic duct also they have asked the question in the exam. यार पहले ना आप मुझे ये बताओ. Hello जी. First you people tell me here, sir. What is thoracic duct? What is thoracic duct? It is the largest lymphatic. Thoracic duct will be the largest lymphatic. All the lymph will be finally draining into the thoracic duct, sir. ठीक है ना? all the lymph will be finally drained into the thoracic duct here, sir. अब यहां पर आपको जस्ट याद रखना होगा like 3-4 points here, sir. Thoracic duct begin कहां से होता है? It is going to begin from cisterna chyli. Cisterna chyli कहां होता है? Abdomen में होता है. So therefore, first of all, it has to cross the diaphragm. So remember, it is going to cross the diaphragm from which opening? Aortic opening. Thoracic duct is going to cross the diaphragm through which opening? Aortic opening. Aortic opening will be at which level? T12. It is deviating towards the left at the level of T5. It is deviating towards the left here, sir. You can clearly see here. And then finally वो जाकर drain कहाँ होता है? वो important है. आपके MC एग्जाम में पूछा गया था. It is going to drain at the junction of left subclavian vein and the left internal jugular vein. You can very clearly see here. यहाँ जाकर वो drain होता है. At the junction of left internal jugular vein and the left subclavian vein, sir. Left internal jugular vein and the left subclavian vein, वहां पर जाकर वो ड्रेन होता है. तो जो पॉइंट्स मैंने हाईलाइट किया है, अगर आप वो याद रखोगे, that is all about the thoracic duct that you have to remember, sir. So thoracic duct is going to begin from cisterna chyli. It is going to cross the diaphragm at T12, then deviating towards the left at the level of T4, and finally draining the lymph where at the junction of left subclavian vein and the left internal jugular vein here, sir. Done, done, done. And then, my dear friends, welcome to the next topic, abdomen topic, sir. In the abdomen topic, first of all, these planes are important. They're asking a lot of questions right now about the planes. And you just have to remember, transpyloric plane will be at which level? L1. It is going through the pylorus part of the stomach. इसीलिए उसका नाम क्या है? Transpyloric plane. Subcostal plane will be at the level of L3. And then supracrystal plane will be at the level of L4 because it is touching the iliac crest, sir. Iliac crest, supracrystal, L4. पूछा गया था आपके MC एग्जाम में. Intertubercular plane between the tubercles, that will be at the level of L5. So again, चलिए सर एक बार दोबारा रिपीट करते हैं हम लोग. Transpyloric plane will be at the level of L1, and then subcostal plane will be at the level of L3. Supracrystal plane will be at the level of L4, and then intertubercular plane will be at the level of L5, sir. And now, my dear friends, in this, observe very, very carefully here. Umbilicus कहाँ है? Umbilicus is between L3 and L4. ओए बच्चों, सुनो ध्यान से. ओ मेरे प्यारे प्यारे बच्चों, अम्बिलिकस का लोकेशन कहां पर है? इट इज बिटवीन L3 एंड L4, सर. ओके, लेकिन अम्बिलिकस का डर्मेटोम कौन सा वाला होता है? रिमेंबर, इट इज T10. बी वेरी केयरफुल इन द एग्जाम. डोंट जस्ट लुक एट द अम्बिलिकस एंड मार्क T10 करके, सर. ठीक है ना? तो जो लोग वो वन लाइनर पढ़ते हैं, ऑल दोस रट्टा मारते हैं ना, खत्म. अम्बिलिकस T10 लगा दो. प्लीज बी वेरी केयरफुल. Recent exam they have given the location, sir. Dermatome will be T10, but location will be between L3 and L4, sir. First concept completed here in the abdomen topic. And now, welcome to the hot favorite concept of your examiner, diaphragm. Diaphragm में कितने major openings होते हैं, sir? How many major openings are there in diaphragm? There are 3 major openings of diaphragm. This one here will be the vena cava opening. Acha. This one here will be the esophageal opening. Acha. And this one here will be the aortic opening, sir. So in diaphragm, you'll be actually having the 3 major openings, sir. There is vena cava opening, esophageal opening, and aortic opening, sir. Vena cava opening, esophageal opening, and aortic opening, sir. So first remember the location. Vena cava opening kahan par hota hai? It will be in central tendon. Okay. Esophageal opening kahan par hota hai? It is in the muscular part of the diaphragm, in the muscle part of the diaphragm. And aortic opening is between the right and left crust of diaphragm, sir. Actually, it is not all passing through the diaphragm. It is between the 2 crusts, right and left crust, sir. तो आजकल ये बहुत इंपॉर्टेंट है, सर. प्लीज रिमेंबर दिस लोकेशन, सर. So in the central tendon of the diaphragm, you're having vena cava opening. In the muscular part, you're having the esophageal opening. And then aortic opening is between the right and left crust. This is the right and left crust of the diaphragm. Aortic opening. Okay. Then you have to remember the favorite part, sir. It is at which level? Vena-caval opening will be at the level of T8. Esophageal opening will be at the level of T10. Aortic opening will be at the level of T12, sir. 8, 10, 12. 8, 10, 12. Easy to remember, sir. And आप सबको अच्छे से पता होगा कि the mnemonic to remember this one, sir. Voice of America. Voice of America. Vena caval opening T8, esophageal opening T10, aortic opening will be at the level of T12. Arman Rao is asking, what is the meaning of dermatome? Please, sir. Dermatome is that part of the skin which will be supplied by the particular spinal segment, spinal cord segment. That is known as dermatome. So the part of the skin which will be supplied by a particular, spinal cord segment. So spinal cord segment, for example, T10. So T10 will be actually supplying to the skin, yes, of umbilicus and paraumbilical region. That skin will be supplied by T10 segment, sir. तो उसी को हम कहते हैं डर्मेटोम. ठीक है ना? ठीक है. I ate 10 eggs at, अरे पता नहीं भाई क्या है. I ate 10 eggs at 12, पता नहीं क्या क्या बोल रहे हैं. चलिए सर आगे बढ़ते हैं. Now, after learning the name of the opening, after learning their location, वो कहाँ होते हैं, अब हमको क्या सीखना होगा सर? We have to learn कि ये अगर ओपनिंग है तो ओपनिंग से तो पास होगा ना, स्ट्रक्चर पास होगा. तो वी गॉट टू लर्न लाइक विच स्ट्रक्चर्स आर गोइंग टू पास थ्रू दिस ओपनिंग. So number one, my dear friend, what is going to pass through the vena cava opening? Inferior vena cava. Inferior vena cava. ठीक है ना? लिखो और भूल जाओ. Please write down and forget about that. ठीक है ना? Why? Because inferior vena cava is passing through vena cava opening, and of course, my dear friend, they will never ever ask you in the exam कि वेना केवल ओपनिंग से तो इंफीरियर वेना कावा ही पास होता है. ठीक है ना? फाइन. नाउ आफ्टर दैट व्हाट एल्स इज गोइंग टू पास हियर, वो आपके माइंड में होना चाहिए. देयर विल बी राइट फ्रेनिक नर्व पासिंग फ्रॉम हियर, सर. व्हिच नर्व इज पासिंग? राइट फ्रेनिक नर्व इज पासिंग फ्रॉम हियर, सर. तो आपका फोकस यहां पर होना चाहिए. Esophageal opening, what is going to pass from here, sir? There will be esophagus passing from here, sir. Along with the esophagus, there will be vagus nerve passing from here. आपका फोकस यहाँ पर होना चाहिए. So remember with the rhyming word esophagus, vagus, esophagus, vagus. And then aortic opening, मैंने अभी आपको बताया, what is going to pass? Aorta. Along with the aorta, thoracic duct. Along with the thoracic duct, even azygous vein is also passing from here, sir. ठीक है ना? Along with the aortic opening, aorta के साथ में thoracic duct के साथ में क्या होगा सर? There will be azygous vein passing, and this is something really, really important here, sir. Are you done? The openings of diaphragm, every point I have completed here, sir. All the openings are done, the levels are done, and then what is passing through this opening, that is also done here, sir. Is it okay? चलिए आगे बढ़ते हैं. Inguinal canal. How can we forget this one here? Now, in this diagram, this is actually your anterior abdominal wall, sir. Anterior abdominal wall, sir. Okay, now, last 10 minutes, everyone pay full attention, sir. We'll finish this and then we'll leave. Then we'll have dinner. In this inguinal canal, I just want you to remember the boundaries very carefully here, sir. Most of the students are actually forgetting like how to remember the boundaries, sir. So I want to make that easy for you. Look at the screen now. Look at this diagram here right now. Transversalis fascia. In this transversalis fascia, you'll be having oval-shaped opening, sir. And that oval-shaped opening will be nothing but your deep inguinal ring. So already in the MCA exam, they have asked this question many a times. Deep inguinal ring is present in which layer? Deep inguinal ring is present in which layer? Transversalis fascia. Then here you'll be actually having a triangle-shaped opening here in the external oblique aponeurosis. And that will be the superficial inguinal ring, sir. Okay, now, the superficial inguinal ring is present in external oblique, sir. Now, what is left out in the middle? That is your internal oblique here and the transversus abdominis, sir. In dono ko jod do. I mean to say, Internal oblique aponeurosis will go here. And even the transversus abdominis aponeurosis will go here. And together they will join to form the conjoint tendon. Conjoint tendon is also known as falx inguinalis. It is formed by internal oblique plus transversus abdominis. Internal oblique plus transversus abdominis. This will combine to form the conjoint tendon. So I want you all to remember first these 3 points here, sir. एक बार दोबारा repeat करते हैं. It is worth repeating right now, sir. So can you please tell me here again? Deep inguinal ring is present in which layer? Transversalis fascia. Superficial inguinal ring is present in which layer? External oblique. And then conjoint tendon is formed by internal oblique plus transversus abdominis. ये 3 point बहुत important है. And after that, the climax of the story here is that join the deep inguinal ring with the superficial inguinal ring. Join the deep inguinal ring with the superficial inguinal ring. And that is going to form the inguinal canal. Are you understanding me? Inguinal canal यहाँ पर form होता है sir. So please remember this concept very clearly in your mind, sir. Inguinal canal exactly कहाँ होता है? Are you understanding me? After that, तो contents वगैरह तो आपको अच्छे से पता है, sir. You know the contents very well. In males, what do you have? Spermatic cord along with a nerve, ilioinguinal nerve. In females, what do we have here? In females, there will be a round ligament of uterus along with the ilioinguinal nerves. So that is the content of the inguinal canal in male and the female, sir. Male and the female, sir. ठीक है ना? ये तो आपको ऑलरेडी पता है. Inguinal hernia तो ओहो, you are like expert in surgery and all, है ना? चलिए आगे बढ़ते हैं. Let us go ahead with the last and final topic that we have to discuss here. That is pelvis and perineum here, sir. Pelvis and perineum here. And in pelvis and perineum, I have to actually teach you like 1 or 2 important concepts here, sir. I'll teach you that one and then we'll leave, sir. Okay, na? The first thing that I want you to understand here is this one here will be the perineal body. Perineal body. Okay, na? In the male. And in the female perineum here, yes, you can easily identify the female perineum here. There is a separate opening for urethra. And then you'll be having a separate opening for vagina. And there will be a separate opening for the anal canal. Now, in between the vaginal opening and the anal canal opening here, you'll be having a body. And this body here will be known as the perineal body, sir. So there will be a dense, tough, fibrous body. And that dense, tough, fibrous body will be the perineal body, sir. Now, what is the importance of this one? They are totally like, 10 muscles meeting at the perineal body. And you have to remember all the 10 muscles, sir. But the good news here is that out of the 10 muscles, 4 muscles will be paired, sir. 4 muscles will be paired. So I will tell you one easy way to remember this 4 paired muscles, sir. In this diagram, this one here will be the bulb of the penis. Agar ye bulb hoga, the bulb will be surrounded by this muscle here. This muscle will be bulbospongiosus muscle. What is the name of the muscle? Bulbospongiosus muscle. And it is a paired muscle. We got the first pair. And this transversely going muscle here, sir, this muscle which is going in transverse direction here, this one will be the obviously transverse perineal muscle. We are in the perineum region, transverse perineal muscle, sir. And this one will be the superficial transverse perineal muscle. And there is a one more deep to this one, which is not visible in this diagram here, sir. Just maan lo ke hai. And that one will be the deep transverse perineal muscle, sir. And then, my dear friends, the muscle which are actually sloping down from here, this muscle will be your levator ani muscle, sir. Wow. So if you just remember this diagram in your mind, that's all, sir. We got the 4 paired muscle. Okay, na? And all that 4 paired muscle, easy to remember, sir. Bulbospongiosus, superficial transverse perineal, deep transverse perineal, and the levator ani. Now, what are the 2 unpaired muscles? Number 1, are you all able to see this one here, sir? External anal sphincter. That is also meeting at the perineal body, sir. The external anal sphincter is also meeting at the perineal body. Okay. So that is one unpaired muscle. And the last unpaired muscle will be present inside actually, sir. That is the longitudinal muscles of anal canal. Longitudinal muscles of anal canal. That is, unpaired, sir. So in total, 10 muscles are going to meet at the perineal body. and that is made easy in the class itself, yes, sir, in our session here, sir. Understanding? So there'll be like 4 paid muscle and there'll be 2 unpaid muscle. Easy to remember, sir. याद हो गया? है ना? Are you done, sir? Next, sir. Now, welcome to one last and final thing here, my dear friends. Look at this diagram here. In this diagram, the muscles which are actually sloping down from here, these muscles are going to form your pelvic diaphragm, sir. This is nothing but pelvic diaphragm. And pelvic diaphragm is made up of 2 muscles, and those 2 muscles will be levator ani muscle and coccygeus muscle. Levator ani muscle and coccygeus muscle. And this diaphragm that you're able to see here, this one will be the urogenital diaphragm. And urogenital diaphragm is also made up of 2 muscles, external urethral sphincter muscle and deep transverse perineal muscle. So remember, the pelvic diaphragm is made up of 2 muscles, levator ani muscle, and then there will be coccygeus muscles. The urogenital diaphragm is also made up of 2 muscles, external urethral sphincter muscle and then the deep transverse perineal muscle. Okay, so these 2 things are also done, and we're done with the perineal body. Okay, and now, my dear friends, before ending this session, I want you to tell one thing here. Okay, now, before ending this session, I want to tell you one thing here, sir. In your MCI exam, there will be a clinical case about the extravasation of urine. Extravasation of urine is very, very, very much important. मतलब definite और पक्का question आएगा आपके exam में, sir. In your MCI exam, there will be a definite question about extravasation of urine, where there will be rupture of membranous urethra or there will be rupture of the bulbar urethra. Okay, na? And that right now will not be doing that one, sir, because there is a complete session that I have done on based on that one, sir. Hardly a matter of 15-20 minutes or 25 minutes, something like that. There is a session of extravasation of urine on Dr. Tutorial's YouTube channel. I have done on Dr. Tutorial's YouTube channel there. और वो आप एक बार देख लेना सर ध्यान से, ठीक है ना? तो एक्स्ट्रावेसेशन ऑफ यूरिन पक्का एक आपको ना सवाल पक्का आएगा वहां पर, और उसको आप अच्छे से देखना. अगर बल्बार यूरेथ्रा रप्चर होगा तो यूरिन कहाँ जाएगा, और अगर मेम्ब्रेनस यूरेथ्रा रप्चर होगा तो यूरिन कहाँ पर जाएगा. दैट यू कैन वॉच ऑन द डॉक्टर टुटोरियल्स यूट्यूब चैनल आराम से कभी भी, सर, ठीक है ना? ठीक है. सो दैट्स अ कंप्लीट कॉन्सेप्ट रिगार्डिंग दिस वन हियर. सो वी हैव actually revised the neuroanatomy and then the head and neck, and then I think we have discussed about the embryology, upper limb, lower limb, thorax, abdomen, like in detail. All the concepts has been discussed, all the higher topics which are required for you to learn before going to the exams. Okay now, so I think this session was helpful to you, my dear friends, and I think I will sign out right now, sir. I'll take a break right now, है ना? तो ये था आपका completely remarkable rapid revision session of anatomy for all the students who are actually studying for your January FMG exam, sir. So I wish you all the best. May God bless you with all the success. May you come out with the flying colors. And आप इसको ना अच्छे से revise कर लेना. This is the best thing which is possible in the given time here. And we are done with almost the revision of all the higher topics in the entire anatomy part, sir. ठीक है ना? Fine here. I think आपके सारे concepts यहाँ पर revise हो गए होंगे, है ना? I think all the concepts has been revised here. So all the best, my dear friends. And if you have any doubts or something like that, you can actually contact me on this WhatsApp number. So this is the only one WhatsApp number I'm having, and or else on the Instagram, Anatomy Dr. Azam. These are the 2 places. I'll help you out till your exams. We are with you. I'm with you. The team Dr. Tutorials is with you, and even our beloved sir, Dr. Bhanu Prakash sir, is also with you, and he has given a very good opportunity interacting with you people on his YouTube channel here. My pleasure helping you out, sir. Okay, now. So thank you all, guys. Thank you all for listening to me for so long. Almost it has been like 3.5 hours. Thank you all. Thank you. Thank you, Z. Thank you. Thank you. Yeah. Biochem also will be doing, inshallah. I'll discuss and we'll try to do it. Fine. So thank you all, guys. Take care. God bless you. And even pray for me also. Pray for my health. That is the only thing I need. Pray for my health, sir. Thank you. Thank you all, guys. Take care.